What's going on, world? Hey. Welcome. Today is Friday. I'm sorry. I don't know why I'm even remotely doing anything like that. But hey, welcome. Today is Friday. Yeah, we're going to be doing NCLEX questions today. You already know the deal. You already know what we're doing. We're going to be doing questions today. Hopefully everybody had a good week. I know it was only like 2 days ago that I saw y'all, or y'all saw me, or whatever you guys want to call it. But whatever. Hey, welcome. Welcome. Hey, if you guys are new here, I want you guys to let me know who you are, where you're from, where you are at in your nursing journey. Y'all already know the deal. Once we get 100 people up in here, we're going to turn this thing around and we're going to start knocking out these questions. All right. Quick, some housekeeping. 7-day NCLEX course. It is going up in price. Y'all, it's going up in price next Friday. So on Black Friday, I know you guys are like, Black Friday is supposed to be for discounts. Well, I mean, we're doing things a little bit different around here. Doing things just a little bit different around here. So if you guys are here for it, you already know what we're about to do. We're going to be doing NCLEX questions. My name is Kevin. Been a nurse for a little over 3 years now. Worked in ICU, worked in the OR, and worked at PACU. Still currently have a job with the OR. So that's where your boy is at right now. 16 years in the Navy. Hit my 16-year mark in September. So on the road to getting out or road to retirement. I haven't decided yet. So I want to know who you are, where you're from, where you are at in your nursing journey. What question do you guys have? Make sure you guys like, right? Smash that like button. Don't be greedy your whole life. All right. Smash that like button. Make sure you guys share and make sure you guys follow. Those are the things that I need to get this live out to people who need it. Right. And you guys follow because I'm kind of funny sometimes, and make sure you guys share. Because I'm also kind of funny, so I need other people to validate me being funny. Okay. All right. So, like I said, all right, we're going to wait for folks to come up in here. You already know the deal. I know today is Friday. I know people are just like, yo, I'm done for the week. Hey, but come over here and get that knowledge in. Get that knowledge in. All right. Hey, so, hey, how did you guys hear about the live? Did anybody see my TikTok that I posted? Did I cause any trauma? I just want to let you know, every time I post it, it causes trauma to me. It brings back a lot of bad memories for all the code blues that I've done. So what's up? How y'all doing? We're about to do NCLEX questions. You already know the deal. You guys like, share, follow. Hey, spread the word. Once we get 100 people in here, once we get 100 people up in here, you already know I'm going to turn this camera around and we're going to get it on and popping. All right. Also, anybody looking for a one-on-one coaching to help them, conquer the NCLEX, if you are unsuccessful, anything like that, you guys can check that link out. That link is also in my bio, to include the 7-day NCLEX course, which you get for a lifetime for $48, which is also in my bio. All for RA and RN, but I like the refresher. All right, Tabby, shout out to you. So just for those who are just jumping in, I am also an RN. I actually have my bachelor's. It doesn't matter if you have your bachelor's or your associates. People will be trying to flex on you like it fucking matters, but it really doesn't. I mean, it does if you think about it on the educational ladder. But I mean, when it comes to working on the floor, has nothing to do with nothing. Don't let them lie to you out here. Don't let them lie to you. All right. So what else we got going on? Welcome. If you guys are new here, we are about to do NCLEX questions. We do NCLEX questions every Monday, Wednesday, and Friday. So make sure you guys are a part of that. All right. And also, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, hey, what are you doing here? I'm coming to hang out, coming to, get some extra learning on. I have people that are like high school students, 20, 30, 40-year nurses, had some doctors in here, med students. Not Helen Keller. Stop it. Is that your not you saying Helen Keller? Lord of mercy. I can't believe you remember that. My bad. But it says nursing student here, graduation in March, in advanced med surg right now. Shout out to you. Is it Claudizi? I'm guessing that's for Claudia, but I guess I just call you by your government name. So I'm going to call you Claudia because I'm assuming that's what it is. But yeah, have people from all over the world too. I have people that are in here from Nepal, which is still just wild to me. That's where Mount Everest is at, y'all. Mount Everest. Like one of the largest mountains on the planet Earth, right? The Earth, because it's flat. I'm just playing. Okay, Claudia, I see you out there. I see you. Hey, so you already know the deal. Y'all keep liking, y'all keep sharing. Make sure you guys follow. We got to get 100 people up in here. All right, we got to get 100 people up in here. Once we get 100 people up in here, I'm going to turn this thing around and we're going to get it on and popping. Hey, we got a good amount of questions. that are in here. All right. I may not even wait for 100 because, we got we got people that are in here and I don't want to keep everybody waiting. So, hey, but make sure you guys smash that like button. Hey, we have those tiers, right? 1,000, then 10,000, then 20,000. You already know the deal. 1,000, so on and so forth. It says, did you cover mitochondria being the powerhouse of cells? No, I did not. We didn't go over that. I just go over questions, specifically the ones that are for NCLEX. I was about to read that as metachlorian, like this was some type of Star Wars reference, and I'm gonna be like, look, man, my metachlorian count is extremely high. The force that I have that be moving shit around here it's wild. Let me tell you. Hey, so did my TikTok bring anybody here? Look, show me the baby. What baby? I don't know what that means. Like the food baby, because I ain't got to go yet. Do you recommend going to your LPN versus RN? It depends on your pockets, aka depends on how much you want to pay. Do I think going to be an LPN is bad? No, because an LPN is still a nurse. It's just that your scope of practice is just different. Are you a repeat test taker? Yes, I took my NCLEX 3 times, y'all. Three. And let me tell you something. No part of me cares about telling anybody that I took my NCLEX multiple times. I'm telling you right now, because people will be like, oh, you took your test multiple times. And, I tell them like, it doesn't define what type of nurse that you're going to be. I've seen nurses that are some shitty ass nurses that are first time test takers. Not saying anything about first time test takers because they all come in different shapes and sizes. But hey, don't come for me just because, you're insecure about your own thoughts and all the other stupid shit. So anyways, what did you do differently? I took it twice. Well, I took it 3 times and there's a lot of things that I did differently. Biggest thing is your mindset, your environment, and accountability. Like you need to take accountability for what you do and for what you do and for what you don't do. All right. Anyways, we got 60 people in here. I'm not going to hold you guys for the fact that other folks ain't showing up here, but I'm about to turn this camera around and we're about to get it on and popping. All right. So, so we're about to do questions. All right. You guys will see this little screen right here every so often. I like to call them my little commercial breaks, 90s style. Karam, what's up? How are you? And then, so, hey, we're going to do an Ask Me Anything after this. But, hey, we're about to do NCLEX questions. Make sure you guys participate. Give me all them likes. Give me them shares. And make sure you guys follow. Hey, don't be selfish your whole life, right? That's the trifecta of what people want, all right? Arnisha, Pastor. Hey, shout out to you passing that exit. I don't know what you was even worried about. I don't even know what you was even worried about. Also, if you come into my chat and you start trying to troll or be stupid, I'm going to ban you. Literally, it says I'm going to ban that ass. And trust me, I get pure joy out of banning people. Because I'm petty, over 9,000. Also, 7-day NCLEX course. That's a course that I created for a lifetime. You get it for $48 right now. That price is going up on the 23rd. So if you guys are interested, make sure you guys go over there and check it out. That's my pre-Black Friday / pre-launch sale. So you get it for a lifetime. You get all the updates. All right. Also, if you need one-on-one tutoring or if you're looking for coaching and mentoring for nursing and for NCLEX, you can check that out. Also in the link in my bio. And we're going to do an Ask Me Anything after that. All right. So here we go. Also, I'm going to put you guys on a timer because y'all take too long. Here we go. Question number 1. Nurse John is caring for a male client receiving lidocaine IV. Which factor is the most relevant to the administration of this medication? It said decrease in arterial oxygen saturation when measured with a pulse ox, increase in systemic blood pressure, presence of premature ventricular contractions on a cardiac monitor, or increase in intracranial pressure. So what are we thinking? Give me them answers right now. Getting ready to start nursing school. So can't wait for this. Hey, Amy, I'm letting you know, nursing school is about to humble you real quick. But one thing I'll tell you is to get your time management in order right now. Get ready for it because it's going to happen. Ain't no stopping it. So be ready for it. I'm going to give y'all 15 seconds. Hey, if you guys are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. Also, make sure you guys keep smashing that like button. Hey, we need 10,000 likes right now. Penelope, thank you for the follow. Is it I can't even say. Is it Lachey? Thank you for the follow. Colorado. Shout out to what is it? Mile High City, I think, right? That's what it's called. From Memphis. All right now. Hey, they wild out there. RIP Young Dolph. You know what I'm saying? I began in January 8th. Med student here, just here for funsies. Shout out to you. Be here for funsies. Hey, also follow me for funsies. You know what I'm saying? Utah, nurse for 15 years. Okay, shout out to you, Shell. All right, Marlene, LPN program, 3rd term. Shout out to you. All right, y'all, here we go. Baton Rouge, Louisiana. Hey, Boosie from Baton Rouge. You know what I'm saying? Here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is C, right? The presence of premature ventricular contractions on a cardiac monitor. Lidocaine drips are commonly used to treat clients with arrhythmias or whose arrhythmias haven't been controlled with oral medications and who are having PVCs that are visible on the cardiac monitor. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX. All right. So make sure you guys pay attention when you guys are doing these questions. It doesn't matter if you're in school or when you're preparing for NCLEX, but especially for NCLEX, you need to read your rationales of why it's correct and then why it is incorrect, and then understand what section that it comes from. All right. So shout out to y'all. Lidocaine works when amiodarone doesn't. Facts. And also, here's another thing is that if you have the choice between amiodarone or lidocaine on NCLEX, they're not going to try to confuse you. So if it's a choice between lidocaine or amiodarone is the drug of choice. But if there's only lidocaine, pick lidocaine. All right. So here we go. Question 2. Nurse Ron is caring for a male client taking an anticoagulant. The nurse should teach the client to what? Is it report incidences of diarrhea, avoid foods high in vitamin K, use a straight razor when shaving, or take aspirin to relieve pain? Studying for my board. Shout out to you. Hey, everybody's screaming B. Also, hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. It says B, especially with Kumin and Warfriend. Shout out to you. That nurse dude. Pensacola, Florida. Shout out to P-Cola. I've been there. Hey, there's a restaurant in Pensacola called the Five Sisters. I don't know if it's still there, but I really liked it. It was good. I think I went there like 4 or 5 times when I was there. So Colorado, nursing for 30 years. Lord of mercy. I'm 36. I don't know how it makes anybody feel, but yeah, I said it. All right, y'all. 10 seconds. 10 seconds. Morgan from NY. Shout out to you. From Florida. Okay. BSN. Is it Las Cruces, right? Okay. Shout out to y'all. Hey, make sure you guys keep liking. You guys share. You guys follow. Tabby does hospice nursing. Okay. Shout out to hospice. Kev, I got a 99% on my HESI. Fundamental. Shout out to you, Banana. Shout out to you. Hey, I love celebrating all y'all. I appreciate y'all coming and telling me that y'all are being super successful at what y'all are doing. Austin, Texas. Shout out to Austin. Hey, go Horns. I was just there not too long ago. So, hey, I live in San Antonio, so I don't live too far from Austin. But the answer is B. Avoid foods high in vitamin K. The client should avoid consuming large amounts of vitamin K because vitamin K can interfere with anticoagulation. That is part of pharmacological and parenteral therapies. Remember, that is the second largest section on the NCLEX exam. I'm gonna fuck that up. Hey, I appreciate the follows. All right, Dark Raven, thank you for the follow. Obviously, I can say your name. Jessica, appreciate the follow. Thank you. All right, y'all. Here we go. Question number 3. I got a 1055 on my exit HESI. I needed a 900. Now you can focus on the NCLEX. All right, Arnisha, you got this. Do you do NGN videos? So I do. These are free. These questions are free from nurseslabs.com. Free sets of questions, right? But the one thing I'll tell you about the new generation NCLEX is that 70% of your exam is still going to be multiple choice and select all that apply, right? But the last anywhere from 60 to 70% will be the old questions, and then the other 30 to 40% are going to be case studies or different types of questions, right? So we go over some of those, but these are mostly just whatever their questions are. All right. Here we go. Question 3. Nurse Lynette is preparing a site for the insertion of an IV catheter. The nurse should treat excess hair at the site by what? Leaving the hair intact, shaving the area, clipping the hair in the area, or removing the hair with is it deplanatory? Whatever. Pharmacology HESI. Hey, that pharmacology HESI is a monster. I'm just letting y'all know. Alyssa says OKC. You mean like Oklahoma? What's up, Bella? Oh my God. At first I thought it was another Bella. What, Bella? What happened? What happened? I'm gonna give y'all 10, 15 seconds. And I just want to let y'all know Bella is my depilatory. Hey, look, do I look like a 10-year-old trying to figure out how to spell or say? Look, nope. When does anybody ever say that word working as a nurse? No one. There's your answer. Hey, but I love how you guys sound that out. Y'all sound it out for me because your boy's a little slow. I'm just letting y'all know. All right, y'all, here we go. Here's our answer in 3, 2. And our answer is C, clipping the hair in the area. Hair can be a source of infection and should be removed by clipping, right? That is reduction of risk potential. It says, I'm from Delaware and I have 3 weeks until I graduate. Shout out to you. Not at all, sir. Look, I'm just letting you know. Yup. I think that's a thing that you scrub in the circle and put it out. What? I don't know. What? I don't know if I understood that, but anyways, hey, that's reduction of risk potential anywhere from 9 to 12% on the NCLEX, okay? One of the smaller sections on NCLEX, but still can still make a very, very big difference, all right? Here we go. No, that's iodine. I don't even know what y'all are talking about. Y'all keep having that conversation with yourselves. Here we go. Question number 4. Nurse Manasa is caring for an elderly female with osteoporosis. When teaching the client, the nurse should include information about which major complication: bone fracture, loss of estrogen, negative calcium balance, or DeWager's hump. Or somebody's going to say DeWager's hump. Who cares? Who cares? Answer the damn question. All right. Hey, but shout out to y'all. If you guys are new here, make sure you guys like, share, follow. Hey, we need 10,000 likes, y'all. We need 10,000 likes right now. 10,000 likes. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. Hey, if you guys are new here, according to Bella, I'm pretty sassy. But if you come into my chat and you start talking stupid to me, I will talk stupid back to you. What is E? E ain't even on here, bro. What do you mean? I'm gonna give y'all 15 seconds. I'm a junior. Okay. Like in high school or in college? Like which one you mean? New here, Maryland. You graduate May of 24. Shout out to you. Shout out to you. The Gulf Girl 32. You must live like in Corpus. No, let me stop. I'm a speech therapist. Look, Leslie, I need help with my speech because obviously I don't know how to fucking talk. So, but shout out to you for being in here. All right, y'all, here we go. Here's our answer in 3, 2, and the answer is A, bone fractures. Bone fracture is a major complication of osteoporosis that results with a loss of calcium, and phosphate increases the fragility of bones. That's health promotions and maintenance. Yay, Bella got it right. Finally getting something right in her life. But yeah, hey, lower section anywhere from 9 to 12%, or I'm sorry, either 6 to 9 to 12%. One of the lower sections on NCLEX, but every part of NCLEX is very, very important. All right. So you guys need to make sure you guys know that this guy is ruthless. I love it. Allie, look, you must be new here. Hey, y'all better let her know. Y'all better let her know. Why do nurses hate residents? Oh man. Why do we hate residents? Somebody answer that question. I can't answer it. It take me all this damn stream to answer that question. Question number 5. Nurse Lynn is teaching a group of women to perform BSE. The nurse should explain that the purpose of performing the examination is to discover what? Cancerous lumps, areas of thickness or fullness, changes from previous examinations, or fibrocystic masses. What are we thinking? What are we thinking? Shout out to all 300 plus of y'all listening to me run my mouth. If you guys are new here, make sure you guys like, share, follow. I want to know who you are, where you're from, where you're at in your nursing journey. Also, if you're not a nurse, what do you do? We have some speech therapists in here. I've had some med students in here, had some residents in here. Yeah, I've had high school students in here, all that good stuff. Introduce me, Bella. I will not. Bella, you about to get banned. You finna get banned. You already know I love banning people. All right. Hey, if you're a CNA, if you are a patient care tech, a medical assistant, my LPNs, occupational therapist, physical therapist. Hey, I fucking love y'all. Because I'm telling you right now, without y'all, we couldn't make shit happen. What happens if you only get an ADN? Nothing. Nothing happens if you only have an ADN. It means you can still work. You still have an RN. Your degree is important, but your license is more important. Trust and believe me. All right. Medical coder, but I love more. Okay, shout out to you. Pharmacy student, shout out to you, Alyssa. All right, y'all, here we go. Here's our answer in 3, 2, and the answer is C. Changes from previous examinations. Women are instructed to examine themselves to discover changes that have occurred in the breast. That's part of health promotions and maintenance, right? So breast self-examinations are important, right? Because if anything pops up, we need to make sure that we hit it hard and we take care of it so nothing can, progress from there, right? Remember, you have to be an active participant in your care. And also you want to tell your patients that same exact thing. All right. Hey, real quick commercial break. Hey, don't y'all go nowhere. I know y'all be trying to leave when I be trying to tell y'all stuff because y'all be rude. Anyways, hey, commercial break. We're doing NCLEX questions. Make sure you guys participate. I'm kind of funny. Sometimes just depends on how I feel. I'm feeling kind of funny right now. So I appreciate y'all. Make sure y'all share. Make sure y'all like. Make sure y'all follow. Hey, I need 10,000 likes. Stop being greedy your whole life. Don't be selfish. Hey, share this to get it out to people who need it. All right. Also, you come into my chat and you try to troll me, I'm gonna give you a 600, meaning 600 means 10 minutes, which means that's how long I'm going to ban you. AKA, I'm just going to ban you forever because I'm just petty like that. So don't be rude. Also, if you guys see anybody being rude in there, if y'all start yelling 600, that's going to catch my attention. But don't be trying to 600 people just because you don't like them, like Bella. Nurseslabs.com is where I got these questions from. I don't gatekeep. That's where I got them from. You guys can go over there and check them out for yourself. 7-day NCLEX course and tutoring. You guys can check that out. That link is in my bio. I'm going to do an Ask Me Anything after this as well. Also, that price for $48 is leaving. It's going away. It's going up in price to $97. All right. I'm letting y'all know that right now. So if you want to get an NCLEX course and get a jump on it before you graduate within the next 3 to 6 months, I'm telling you. Also, I have a new generation NCLEX review inside of there. It's 8 videos. It's great. You guys should go over there and check that out. Okay. Here we go. Question number 6. When caring for a female client who is being treated for hyperthyroidism, it is important to what? Provide extra blankets and clothing to keep the client warm. Monitor the client for signs of restlessness, sweating, and excessive weight loss during thyroid replacement therapy. Balance the client's periods of activity and rest, or encourage the client to be active to prevent constipation. What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. You guys can go over there and check those out for yourself. They are a free set of questions. They have tons of questions over there. All right. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. I would say I'm just a Filipino here who is forced to be a nurse. I don't even know what that means. You can't be forced to be a nurse, right? That's like somebody saying I got forced to join the military. Some people do. Keyword, important, right? Most important, right? Everybody screaming C at me. That was a tip. Come on now. You already know ain't nobody force you to be a nurse. They be like, hey, Tip, hey, go be a nurse. So I'm going to beat you up. Come on, guy. Come on. B, baby. Okay, girl, I see you out there. Where did you get these from again? Nurseslabs.com. All right, y'all, here we go. Your mom did? Okay, well, I know Filipino moms ain't no joke to mess with. So, so you got forced. Here we go. Here's our answer in 3, 2. And the answer is C. Balance the client's period of activity and rest. A client with hyperthyroidism needs to be encouraged to balance periods of rest and activity. Many clients with hyperthyroidism are hyperactive and complain of feeling very warm. That's part of basic care and comfort. Hey, remember with hyperthyroidism, right? They're run, right? What's another word for hyperthyroidism? Steph, that's what I'm talking about. What's another word for hyperthyroidism, right? Graves' disease, right? Run yourself into the grave. Everything is up. So they're hyperactive, right? Always on the go. So you got to keep them down. You got to be like, hey, bro, chill. You know, it's kind of like what Lil Yachty said to fucking Joe Budden. Hey, chill, relax. You got to keep them down because they will run themselves into the grave. All right, here we go. Question number 7. Nurse Chris is teaching a client with a history of atherosclerosis. To decrease the risk of atherosclerosis, the nurse should encourage the client to what? Avoid focusing on his weight, increase his activity level, follow a regular diet, or continue leading a high-stress lifestyle. Sometimes these questions make me laugh, but you could pick whatever you want. Shout out to all y'all. Shout out to all 600 y'all in here. Listen to me run my mouth. Hey, if you don't like the fact that I talk too much, you know the great thing about the internet is that you could just leave. That's the great thing. You know what I'm saying? And I'm real passive aggressive around here too. I'm just letting y'all know. But I fucking love all 600 of y'all. I love 600 of y'all. You know what I'm saying? And make sure you guys like, share, follow. Also, I got these questions off nurseslabs.com. 10 seconds, y'all. 10 seconds. Bella, you still in here? I ain't seen you say nothing. Hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, who came in here because of my TikTok? I'm sorry if I triggered you, by the way. You from Kansas. Shout out to Kansas. All right, here we go. And the answer is B, increase his activity level. A client should be encouraged to increase his activity level. By the way, some of these rationales aren't going to be the best, and some of these questions are going to be wrong. But just because some of the questions are wrong does not allow you to get everything wrong and to just fail a test. All right, shout out to D-Town. I see you, Sophia. Not a nurse, a paramedic intern. Shout out to my paramedics. All right, ATL. Hey, I just want to let you know, Keith Lee went there and destroyed y'all. Just your restaurants, though. You know what I'm saying? ATL, y'all all right. Y'all cool. All right, Brittany from Texas. Shout out to you, Brittany. All right, hey, and that last one was part of health promotions and maintenance, okay? 9 to 12% on the NCLEX, all right? Make sure you guys read your rationales of why you got it right and also why you got it wrong. Nurse Greta is working on a surgical floor. Nurse Greta must log roll a client following a what? Laminectomy, a thoracotomy, a hemorrhoidectomy, or a cystectomy. What are we thinking? Bridge and paramedic to RN. Shout out to you. Shout out to you. Is it Karen? Karen. Karayan, I'm fucking that up. Thank you for the follow. I appreciate you. What are we thinking, y'all? What are we thinking? I know somebody's going to like, what does log roll mean? Somebody tell them what log roll means. Peter. Oh, Peter. You're from PA. Okay, I got you. Second attempt on NCLEX on Monday. Staying positive. Hey, Peter, you always got to stay positive out here. Hey, I just want to let y'all know, I took my NCLEX 3 times. I failed my NCLEX 3 times and I passed it on the 4th. All right. And no part of me cares about what anybody thinks in regards to about me failing. You know what I'm saying? No job. And let me tell you something. No job fucking cares at all. As long as you got a license so they can put that ass to work. Trust and believe me. All right. Here we go. And the answer, of course, is a laminectomy. Right? That's part of physiological adaptation, which is the third largest section on NCLEX at 11 to 17%. The client who had spinal surgery, such as a laminectomy, should be log rolled to keep the spinal column straight when turning. All right. So be aware of that. Yeah. For spinal precautions, how many times can you take? It depends. It depends on what state that you are in. Because certain states have limits. Like Texas, you have 4 years to take it, and essentially it's unlimited. But Florida, you have like I think like a maximum of like 3 times that you can take it. So hey, if there's anybody that's in here that's taking the exam multiple times, y'all let us know where you're from and how many times you can take it. All right. Question 9: a 55-year-old client underwent cataract removal of an intraocular lens implant. Nurse Oliver is giving the client discharge instructions. These instructions should include which of the following? Avoid lifting objects weighing more than 5 pounds, lying on your abdomen when in bed, keep rooms brightly lit, or avoid straining during a bowel movement or bending at the waist. What are we thinking? Is it Shavana? Says D question mark. Shavana, you got to give me something that's make a decision and run with it. All right. And usually your first decision is the correct decision. And if it's not, cool. This is why these things are done, is so you guys can learn. My whole point of doing this is so you guys can get in the flow of studying, not be afraid of it. Don't be intimidated by it. Imagine getting on TikTok live or going and standing in front of a bunch of students and teaching them this, right? Get through it. Get through it right now. Hey, I need 10,000 likes. Stop playing with me. All right. Make it happen. Bella, you are in charge of making sure I get 10,000 likes. If not, then you're getting a 600. I'm just playing. I love y'all. Who said that? Alex says, I'm new here. How long are the lives? I appreciate you. Alex, I appreciate you being here, big dog. The lives are Monday, Wednesday, Friday, 5:30 Central Standard Time too. Essentially whenever I want to stop. But it usually goes for about 2 hours, 2.5 hours. So, and we do NCLEX questions, got them off nurseslabs.com. But the answer is D, avoid straining during a bowel movement or bending at the waist. Health promotions and maintenance, right? 9 to 12% of the NCLEX. The client should avoid straining, lifting heavy objects, and coughing harshly because these activities increase intraocular pressure. I saw somebody say that down there, so shout out to y'all. Hello, it's Sandra. What's up, Sandra? How are you? So yeah, so definitely we don't want to cause any type of pressure because we don't want that eyeball or we don't want that lens to become dislodged or anything of the sort when it comes to a patient having that eye surgery, right? I'm new here, elicited. Shout out to you. Shout out to you. Hey, here we go. Question number 10. Jorge should be taught about testicular examinations during what? When sexual activity starts, after age 69, after age 40, or before age 20. I know some of y'all are just like, oh my God, why would we talk about that at 69? Oh my God. I'm talking about sucking your teeth and everything. Well, hey, you just got to know. You just got to know when. Before the age of 20? Okay, I see y'all. Everybody screaming D. Then I'm like, oh my God, Kevin, this is such an easy question. Somebody's going to come in here and be like, what's a testicular exam? Remember, people are in different stages of their learning journey and be respectful for that. All right. Here we go. ASAP, probably. Where you see ASAP at? All right, y'all. Here we go. Here we're coming with the answers. D, sorry. Okay, House of Carbs. Hey, you got some pasta over there? I'm saying carb loading is good sometimes. You know what I'm saying? Here we go. Alex, I appreciate the follow. I work on med-surg as an LPN. We circumcision at 72. Look at that. Look at that, Aaron. That's what hey, let them know what's going on out here. Here we go. Here's our answer in 3, 2, and the answer is D, before age 20. Testicular cancer commonly occurs in men between ages 20 and 30. That doesn't mean after 30 that you can't get it, by the way, fellas. A male client should be taught how to perform testicular self-examination before age 20, preferably when he enters his teens. That's part of health promotions and maintenance. All right. So make sure when you guys are reading your questions and you're answering or reading your rationales, that you are reading why it is correct, but then also read why these are incorrect. All right. And then know what section this comes from. The more familiar that you are with the process, the better chance that you have of conquering this exam. Hey, break time. Don't you go nowhere. Right? That's me being aggressive. Don't you go nowhere. Hey, we're doing NCLEX questions. I got them off nurseslabs.com. I don't gatekeep. You guys can go over there and check them out for yourself. Also, participate. I'm kind of funny and kind of passive aggressive. I'm working on a lot. I go to therapy. All right. Don't judge me. All right. So make sure you guys like, make sure you guys share, make sure you guys follow. Hey, we need 20,000 likes. Make it happen, baby. Make it happen. Don't be selfish your whole life, okay? Share this to somebody who you feel may need it, all right? Hey, don't troll my chat. You troll my chat, I'm going to give you a 600. Right? I should just put 600 on a shirt. People are going to be like, what does that mean? It means band world, baby. That's where you're going. You come over here and you act a fool. I'm going to ban that ass. Literally, it says, I'm going to ban that ass. I should just make a TikTok just for that. All right. So don't be rude. All right. 7-day NCLEX course. That's my NCLEX course that I created. It is $48. No, it's not a game. No, it's not a joke. It's for a lifetime. You guys can get it forever. That price is it's going up in price. It ends on the 23rd. So make sure you guys go over there and check that out. Also, if you want help with the NCLEX 101, have you failed? Are you confused? Don't know where to start? Check your boy out right there. thebootnurse.com/coaching. Also, those links are in my bio. And we're going to do an Ask Me Anything after this. All right, we're going to do an Ask Me Anything. Who said that? Sweet says, I'm a surgical tech and you're motivating me more to become a nurse. Hey, so I'm a surgical tech. I'm actually in the Navy as a surgical tech. I've been a surgical tech instructor. I was one for 3.5 years. And I was also the clinical coordinator at the surgical tech schoolhouse. I enjoyed it. I loved it a lot. That's where I started my whole teaching journey officially. So, shout out to all my surg techs that are out there. Here we go. Question 11. A male client has undergone a colon resection. While turning him, wound dehiscence with evisceration occurs. Nurse Trish, first response is to what? Call the physician, place a saline-soaked sterile dressing on the wound, take blood pressure and pulse, or pull the dehiscence close. What are we thinking? Easy peasy? All right. Hey, easy peasy for some folks, but some folks are in different, stages of their nursing career, right? I had some high school students that are just like, bro, I have no idea, but I'm a guess. I would rather you guess. All right. B, for infection control. Shout out to you. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys like, share, follow. Best way to study for ATI farm proctoring. I don't know. I've never taken ATI, but I can always assume that with pharmacology, you need to know family name and suffixes, right? Most of them all fall under the same. So think about your pharmacology meds, right? Or not your cardiac meds, right? What's your answer? Oh, I see what you're saying. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is B. Place a saline-soaked sterile dressing on the wound. The nurse should first place the saline-soaked sterile dressing on the wound to prevent tissue dryness and possible infection. That is physiological adaptation, which is the third largest section on the NCLEX, ladies and gentlemen, at 11 to 17%. That covers chronic trauma, from adult to child, right? Is everyone a nurse? No, not everybody's a nurse. I have some nursing students. I have PAs in here, paramedics, surg techs, anybody that's looking to hit that goal. Don't even matter. I don't care why you in here. As long as you in here rocking with me, get your learn on, passing it on to somebody. Look, hey, as long as we out here doing it, baby, we out here doing it. I'm just letting y'all know what the deal is. All right, here we go. Question 12. Nurse Audrey is caring for a client who has suffered a severe cerebrovascular accident. During a routine assessment, the nurse notices, Cheney-Stokes respirations. These respirations are what? I'm pretty sure I said that wrong and somebody's going to correct me with the spelling down there, but no part of me fucking cares, y'all. Okay. Anyways, progressively deeper breath followed by shallower breaths with apneic periods. Is it rapid breathing with abrupt pauses between each breath? Rapid deep breathing and irregular breathing without pauses? Or is it shallow breathing with an increased respiratory rate? What are we thinking? What are we thinking, y'all? Got some A's, we got some B's. Hey, if you guys are new here, welcome. Hey, at one point, we just had over 700 people in here. So shout out to y'all. If you guys are new here, I want to know who you are, where you're from, where you are at in your nursing journey. If you're not a nurse, tell me what you do. Tell me why you're here. You know what I'm saying? Make sure you guys like, share, follow. Hey, we got to get to 20,000 likes, y'all. We got to get to 20,000 likes. You know what I'm saying? We got to get there. 10 seconds, y'all. 10 seconds. You need this for NP8. Hey, I'm pretty sure there's somebody out there. Here's one thing I could tell you is that if you guys are trying to take like PACE or what is it, the USMLE, the best way for you to learn is to get on here and start teaching it to other people. I promise you, it'll start to sink in at some point. Harry says I'm an ICU nurse for 4 years. Shout out to you, Harry. I worked ICU for a little over a year. I worked in the burn unit or burn ICU. I worked in a medical and a neuro ICU. I learned a lot. Then I left because, there's a lot of unethical things that were happening in my opinion, so not my opinion, but were. LPN in Canada. Shout out to Canada. So here we go. Here's our answer. Answer is A. Remember, that is part of physiological adaptation. And it's what? Physiological adaptation is a part of what? What's the percentage? Hey, I say it all the time. I need for y'all to know that. All right. A. So it's progressively deeper breaths followed by shallower breaths with apneic periods, right? So these respirations are breaths that become progressively deeper, followed by more shallow respirations with so there it is. It's just repeating itself. So it's super important that everybody, you have to read your rationales. I want to go in for the NCLEX exam. You want to, or you're going to. There's a big difference. We're going to change verbiage out here. Hey, instead of you telling me that you want something, telling me that you're going to go get something. Jules, shout out to you for being a surge tech. All right. Hey, so like I said, I've been a surge tech since 2010. I was an instructor from 2015 to 2018. I'm a trauma nurse instructor, as well as I'm a preceptor at my hospital, all that good jazz. So, hey, your boy loves teaching RNFA. Shout out to you being an RNFA. That's what I'm talking about. A couple of my friends are doing that too. Nurse 13. Question 13. Nurse B is assessing a male client with heart failure. The breath sounds commonly auscultated in clients with heart failure are what? They're tracheal, fine crackles, coarse crackles, or friction rubs. What are we thinking? What are we thinking? Shout out to all 666 of y'all. Lord, please protect me and my whole chat from the numbers that were just on here. But shout out to y'all. Hey, I want to know who you are, where you're from, and where you're at in your nursing journey. Also, hey, we got these questions off nurseslabs.com. Nurseslabs.com. There are free sets of questions. You guys can go over there and check that out for yourself. Hey, so you're telling me B or C. Hey, make up your mind. You got to give me one. Make a decision and run with it, y'all. Make a decision and run with it. This is why it's practice. You got to practice hard. That way you can go out there and show out at the game. 53 people, y'all. Hey, shout out to all y'all. 860. That's what I'm talking about. 868. All right, here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is B, fine crackles. Shout out to all 900 of y'all, right? Fine crackles are caused by fluid in the alveoli and commonly occur in clients with heart failure. That is part of physiological adaptation. It is the third largest section. All right, the third largest section on NCLEX, right? At 11 to 17%. All right, we have over 900 people in here, y'all. So let's keep it rocking. Y'all keep liking, y'all keep sharing, y'all keep following. That is what we do. Make sure you guys read your rationales on why it's correct and then why these are incorrect. While you are studying, do not be surprised, okay? Don't be surprised on when you're studying, you'll see a question that's similar to the one that you just answered 5 or 6 down the line, all right? Michigan MedSurg, shout out to you for being, MedSurg too. Oh, okay, I see you out there. Here we go. Question 14, the nurse is caring for Kenneth experiencing an acute asthma attack. The client stops wheezing and breath sounds are audible. Oh my God, they're not audible. You can't hear nothing, right? And it's okay for you to read word questions as well, right? The reason for this change is what? The attack is over. The airways are so swollen that no air cannot get through. The swelling has decreased. Crackles have replaced wheezes. What are we thinking? What are we thinking, right? Kenneth needs a ventilator. Oh, he just might. I don't know the answer, but we about to figure out. All right. Kenny. Oh my God, they killed Kenny. You bastards. Hey, I got any South Park folks up in here? I just want to let y'all know. You already know code. Hey, did anybody come in here because of my TikTok? Because of the code blue? I'm sorry if I triggered y'all. I'm sorry. All right, y'all. Y'all are all screaming B. Got some D's out here. Throw some D's on it. All right. Let's see what we got. That was funny. All right, here we go, y'all. Here we go. Here's our answer in 3, 2. Right. Hey, so the answer is B. The airways are so swollen that no air can get through, or air cannot get through. I didn't write these, y'all. I'm just letting you know. Physiological adaptation. Third largest section on NCLEX, 11 to 17%. You guys will always hear me reiterate the section numbers, okay? Also, yeah, my man needs to be intubated, straight up, right? He ain't breathing, so we got to put a tube down his throat so we can breathe for him, all right? That was an easy one. Depends on who you are. Everybody's in a different stage of their nursing journey, and some people don't know that yet. So you guys got to realize that, wait, we got a group of folks in here that are on a different journey, all right? Or on different parts of that journey, okay? During an acute attack, wheezing may stop and breath sounds become inaudible because the airways are so swollen that air can't get through, aka my man ain't breathing, aka sedate and intubate, or just intubate and then sedate along the way. All right, here we go. Question 15. Shout out to all of y'all that are in here. Mike with epilepsy is having a seizure. During the active seizure phase, the nurse should what? So he's actively having a seizure, what is the most important thing that we need to do? Think about somebody who's having a seizure, okay? So is it place client on his back, remove dangerous objects, and insert a bite block? Place the client on his side, remove dangerous object, and insert a bite block. Place the client on his back, remove dangerous objects, and hold down his arms, or place the client on his side, remove dangerous object, and protect his head. What are we thinking? What are we thinking? Everybody scream. I got 15 people that said D. Got some people in here saying A. Hey, welcome. Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, I'm going to do an Ask Me Anything after this. Okay, I'm going to do an Ask Me Anything after this. So essentially, whatever question you guys have, if I can't see them, we can all answer them together. All right. Also, I got these questions off nurseslabs.com. You guys can go over there and check them out. There are free sets of questions. Make sure you guys keep smashing that like button. You guys are sharing and you guys are following. All right, here we go. Risk of aspiration. Okay. Michigan, Missouri. Okay. You start school in January. Shout out to you. Is it Olivia? Okay. Is it Axie? Thank you for the follow. MSN 25 years or MSN minus 25 years. That would put you in the negatives. I don't know how that works. So here we go. Here's our answer in 3, 2, and the answer is, of course, it's D. So D for all those easy folks that's out there, right? Place the client on his side, remove dangerous objects, and protect his head. During the active phase, initiate precautions by placing the client on his side, removing those dangerous objects, and protecting his head from injury. That is part of safety and infection control. You passed your NCLEX in 2005 and in 21? What the hell? Oh, you must have let yours lapse and you wanted to go back and be a nurse and you had to go take it again. I'm not saying it's rare, but that's what you have to do if you let it lapse. Hey, by the way, if y'all take your NCLEX and you don't renew your license after a certain time, you got to go back and take the NCLEX. So it would behoove you to always do those CEUs to just keep that RN license there, unless you don't ever plan on working as a nurse again. All right. So shout out to everybody that's in here. Here we go. Real quick, commercial break. Hey, don't you go nowhere. All right. You stay right there. All right. We're doing NCLEX questions. Make sure you guys participate. I'm kind of funny. Today's Friday, so I'm just going to be super funny for y'all. All right. Share, follow, give me all them likes. Hey, I need 30,000 likes. Make it happen right now. Don't be selfish your whole life. Share this to somebody who you feel may need it. Okay. Like I said, don't be selfish your whole life. Hey, if you come into my chat and you try to troll me or anybody else, I'm going to give you a 600. Y'all can read what it is, but just know I'm going to ban that ass because I thoroughly enjoy it and I'm petty over 9,000. All right. Nurseslabs.com, like I said, is where I got these questions from. You guys can go over there and check those out for yourself. 7-day NCLEX course. That is my course. That is my baby. Right? Lifetime access for $48. You get right now, there are 55 videos in there with a projection of there's going to be over 150, right? I have a new generation NCLEX review in there. If there's anybody in here that's in the program, tell them what's in it, and I'm going to show you guys what's in it later as well. Also, if you're looking for one-on-one tutoring for the NCLEX, you guys can check those links out in my bio. All right, here we go. Question number 16. After insertion of a chest tube for a pneumothorax, a client becomes hypotensive with neck vein distension, tracheal deviation, absent breath sounds, and diaphoresis. Nurse Amanda suspects a tension pneumothorax has occurred. What causes a tension pneumothorax, what cause of tension pneumothorax should the nurse check for? Is an infection of the lung, kink or obstruction or obstructed chest tube, excessive water in the water seal chamber, or excessive chest tube drainage? What are we looking for? Oh, Kelly says O. O is not an answer, madam. The answer is B. Okay. Everybody screaming B. Aaron says C. Okay. What else we got? Shout out to all 700 of y'all in here. Hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys like, share, and follow. That is the trifecta that TikTok loves. Let me tell you, it doesn't love it. All right. Hey, y'all, I've been a nurse for 3.5 years. I worked ICU, I've worked PACU, and I've worked OR. Honestly, my best part, PACU. I thought PACU was great. PACU is great. Lost interest. I don't know. Was you lost interest in what? Heaven and Cass, thank you for the follow. Appreciate y'all. A little gift for myself. Thank you for the follow. Appreciate you. All right, y'all. Here we go. Here's our answer. In 3, 2. Is it Raina? Thank you for the follow. Appreciate you. And the answer is B. It is kinked or obstructed chest tube. Kinking and blocking of the chest tube is a common cause of attention pneumothorax. That is why every time we go in and we know a patient that has a chest tube, those are one of the things that we're assessing to make sure that the suction is good, the water seal is good, and then make sure that there's a good seal on all aspects of the pleurovac as well as at the site, right? And we want to make sure that there's no kinks in there, right? So we don't want to cause a pneumothorax because they already have a chest tube. Now they're already having all these other issues, right? Reduction of risk potential, all right? Texas Tech graduated December 16. Hey, user 97, are you in that accelerated BSN program for Texas Tech? Because I know that they have a 12-month accelerated BSN program, and it is a monster. It is a monster. How do you feel about OR nursing? Love it. I work in the OR right now. Hey, yeah, so I have a few of my friends that did the 12-month BSN program through Texas Tech, and it is a monster. Hey, so tell us your opinion on that. I'm actually curious. Here we go. Question 17. Nurse Maureen is talking to a male client. The client begins choking on his lunch. He's coughing forcefully. The nurse should what? Stand him up and perform abdominal thrust maneuver from behind, lay him down, straddle him and perform the abdominal thrust maneuver, leave him to get assistance, or stay with him, but don't intervene at the time. What are we thinking? Hey, remember, I know some people are going to say that this question is easy, but remember, people are in different stages of their journey and don't know exactly what to do as a nurse. And so now we're trying to get them into the swing of answering these types of questions, okay? If he's coughing and he shares the airway, look at you. You're so smart. You're so smart. Is it Miss Juvie? Thank you for the follow. Appreciate you. From Connecticut. Okay. Coughing means so he's good. All right, Nick. Thank you for the follow. Appreciate you. Nick says A. Okay. Is it Becky? Thank you for the follow. Appreciate you. Hey, all right. Cool. Stay with him. Always stay with your patient. You always have to stay with your patient, right? But just because you stay with them don't mean that you don't do nothing. Come on, guys. Come on. I'm a patient care check. Would you think it would be better to do EMS a year? No, go straight to nursing school. Logan, stop playing. Stop playing with your time, right? Stop playing with your time. All right, that's the biggest thing. People are just like, hey, do you think I should go to nursing school or should I wait? The fuck? What kind of damn question is that? Take that ass to school and get that shit over and done with. All right, here we go. If the patient is coughing, he should be able to dislodge the object or cause complete obstruction. If a complete obstruction occurs, the nurse should perform the abdominal thrust maneuver with the client standing. Kevin, you sassy? First of all, ma'am, stop calling me sassy before I ban you. All right. I'm sorry. That's a little aggressive. Then that's all out of love. Hey, FYI, we just had 1,000 people up in here, y'all. Y'all keep sharing. It's great. Hey, so yeah, you stay with your patient, but like y'all saying, he was coughing, so he has an airway. It'd be like, hey, you Gucci, you good, you don't need me, but I will stay with you though. I will stay with you because if you lose that airway, then I don't need you falling, collapsing, causing any other kind of issue to yourself. Also, that's safety and infection control. All right. Safety and infection control. Here we go. Question number 18. Nurse Ron is taking the health history of an 84-year-old client. Paint the picture, y'all. An 84-year-old client. Which information will be most useful to the nurse for planning care? Right. So what is most useful? What is the most useful thing that I could tell an 84-year-old person? General health for the last 10 years, current health promotion activities, family history of disease, or marital status. What are we thinking? What are we thinking? We got some D's, we got some A's, we got some B's. Hey, if you guys are new here, welcome. Make sure you guys like, share, and follow. Hey, we're almost at 30,000 likes, y'all. Make it happen, yo. Hey, 30,000 likes. Bella, what are we doing? You're failing. You're failing me right now. It's making me sad, okay? User 97, thank you for the follow. Appreciate you. I'm going to give y'all 15 seconds, all right? Hey, so I got these questions off nurseslabs.com. There are free sets of questions. You guys can go over there and check that out for yourself. Somebody just gave me a heart. Let me give you your shout out because I synced that come through. Mrs. Walker, appreciate the heart. Is it Mrs. 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 Schwaldezy. Appreciate the follow. I know I just butchered that. I tried. I'm sorry. All right. Cool. Let's see what the answer is, y'all. Let's see what the answer is in 3, 2. And the answer is B, current health promotion activities, right? Recognizing an individual's positive health measures is very important. That is part of health promotions and maintenance. Remember, we want to know how this 84-year-old is doing. Like, I don't need for them to be sedentary. I don't need for them to be doing things that are really crazy excessive, but I need for them to be keeping their health in line in some way, shape, or form. So that's what I always want to promote, so we can keep them to 85, to 86, 87, that way we can do all those things. You're done. What happened? What'd I say? All right, here we go. Question number 19. When performing oral care on a comatose client, all right, a comatose client, right? Nurse Krina should what? Apply, was it a lemon glycerin to the client's lips at least every 2 hours. Brush the teeth while the client is lying supine. Place the client on the sideline position with the head of the bed lowered, or clean the client's mouth using hydrogen peroxide. What are we thinking? What are we thinking? Shout out to y'all. Got these questions off nurseslabs.com. Also, I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, what you doing here? What you doing here? Coming to hang out with us. What y'all doing? How good is the predictor for HESI? I don't know. New Zealand. Shout out to New Zealand. McKenna, shout out to you. Thank you for the follow. I personally didn't do well on the predictor HESI, to be honest. Respiratory therapist, shout out to you. Hey, I want to let y'all know I learned everything that I needed to know about the vent from a respiratory therapist. So I'm telling y'all right now, y'all start working in the ICU or doing anything, y'all better find y'all an RT, and y'all better attach yourself to the hip to them, because they will tell you everything. Once you learn about perfect hats, they will let you know. They'll let you know the immediate things that you need to know in order to keep the patient stable, and then you start learning everything as time goes. So shout out to all my RTs out there. I love y'all. I got a bunch of friends that are some RTs. And the correct answer is place the client on a side position with the head of the bed lowered. Right, the client should be positioned in a sideline position with the head of the bed lowered to prevent aspiration. A small amount of toothpaste should be used and the mouth swabbed or suctioned to remove pooled secretions. That is physiological adaptation, which is the third largest section on NCLEX, y'all, at 11 to 17%. All right, I saw somebody say something about OR nursing. Are you asking about OR nursing? So I'm an OR nurse. I'm an OR nurse. I used to work ICU. And, but I was a surgical tech, and I was like, you know what? Let me go back to the OR. I like the OR. It's 1-to-1 ratio, right? You always got a tech, you always got an anesthesia provider, and you always got a surgeon, and there's you. So you'll have a minimum of 4 people with 1-to-1, right? Bing bong. Are you rushing me? Like, I don't know what that means. OR is boring. Hey, to each their own, right? Some people like boring. Boring is okay. I'm an OR nurse, you're Sharon. I got you, Yori. I got you. Here we go. Can someone fill me in? What is the topic, please? We're doing NCLEX, brown sugar. We're doing NCLEX questions. All right. And the topic is just, they're all over the place. It's a comprehensive, right? Here we go. Question 20. A 77-year-old male client is admitted with a diagnosis of dehydration and change in mental status. He's being hydrated with IV fluids. When the nurse takes his vital signs, she notes that he has a fever of 103, a cough producing yellow sputum, and a pleuritic chest pain. The nurse suspects this client may have which of the following conditions? Is it an acute respiratory distress syndrome, myocardial infarction, pneumonia, or tuberculosis? What are we thinking? It says, yeah, I'm just here to test my knowledge. Shout out to you. I'm glad that you're here testing your knowledge. Pneumonia. All right, Sim, I see you. Hey, shout out to everybody that's in here. Shout out to y'all. On question 20, got these questions off nurseslabs.com. This is a comprehensive exam that they have on there. They have tons of them on there. You guys can go over there and check them out for yourself. All right. Also, make sure you guys keep liking, you guys keep sharing, you guys keep following. Hey, we need 40,000 likes, y'all. EMT here. Love our nurses. Hey, shout out to you. Hey, I used to be an EMT way back in the day. Nymph Love, shout out to you. I'm glad y'all think this is awesome. I do this Monday, Wednesday, and Friday. 5:30 Central Standard Time. Y'all, we got 1,000 people up in here. So let's come up with the answer, y'all. Let's come up with the answer. 1,000 folks are listening to y'all. Listening to me run my mouth and watching y'all. So here we go. DMP in the house. Shout out to you, Miss Loretta. I'm here for the rest of the tour. I'm just playing. Here we go. Oh God. And the answer, y'all, is C. It's pneumonia. Fever, productive cough, and pleuritic chest pain are common signs and symptoms of pneumonia. Hey, Miss Loretta, you set me up for that. So you probably shouldn't even have your name like that. I'm just saying. But shout out to you, Miss Loretta, DMP. I appreciate you. Hey, physiological adaptation. Thank you, Grey's Anatomy. Please leave. Just leave right now. Physiological adaptation, 11 to 17% on the NCLEX, which makes up it is the third largest section on the NCLEX exam. All right. Third largest section on the NCLEX exam. So, hey, trauma, acute care, chronic care from adults to peds, physiological adaptation. That's what it does. What's up, user 57? How are you? Welcome back. Hey, real quick, don't y'all go nowhere. Hey, look, we're doing a commercial break. We're doing NCLEX questions. I got these questions off nurselabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Make sure you guys participate. Participation is the key. Like, share, and follow. Sharing is important, y'all. Y'all got to get it out to folks. Y'all got to get it out to folks so y'all know that we do this. And I say we because we do this collectively as a team, because that's what nursing and medicine is about. We got to change the fucking dynamic, y'all. We got to change the dynamic on what nursing is about. We got to be a better team. All right. Hey, don't be selfish your whole life. Hey, if you troll my chat, I promise you, I will ban you. I got you. I will ban you. I enjoy banning people. It is therapeutic for me. So don't be rude. All right. Also, 7-day NCLEX course, $48. Yes, it's $48, y'all. Y'all can go out there. Y'all can get it for $48. You get it for a lifetime, and you're going to get all the updated videos that I'm going to put in there. All right. That price is going up. So that $48 is going away on the 23rd. All right. And also, if you're looking for coaching, that link, both those links are all in my bio. You guys can go over there and check that out. What NCLEX do you do? Both RN and LPN. They're both relatively the same. I just found out I passed NCLEX. Nessa, shout out to you, Vanessa. Hey, I need everybody right now, while you guys are answering this question, give Vanessa her flowers right now. I need for y'all to tell her congratulations. Tell her that you love her. Tell her that she's great. Hey, congratulations. Welcome to the largest, greatest shit show on the planet Earth, Vanessa, of being a nurse. What type of nurse are you? And then some type of advice that you could give to other people that are going to take their NCLEX as well. All right. Hey, here we go. While you guys give her flowers and she tells us that, I'm going to read this question. Nurse Oliver is working in an outpatient clinic. He has been alerted that there is an outbreak of tuberculosis. Which of the following clients entering the clinic today is most likely to have TB? Probably Doc Holliday. I'm just playing. A 16-year-old female high school student, a 33-year-old daycare worker, a 43-year-old homeless man with a history of alcoholism, or a 54-year-old businessman. What are we thinking, y'all? What are we thinking? I appreciate everybody giving me my flowers, but y'all got to make sure y'all give Vanessa her flowers. All right. What are we thinking? What are we thinking? Hey, by the way, if y'all come into my chat and y'all tell me that y'all pass NCLEX, and if this live has helped y'all, let me know, because I will give you all the love in the world. I promise you that. Hey, by the way, if you don't like me cursing, I'm sorry. If you don't, you can go on the internet and complain, or you can call your congressman, whatever you want to do. All right, y'all, 10 seconds. 10 seconds is between B and C. Give me an answer. Give me one right now. Probably B or C. Give me one. Hey, make a decision and run with it. Make a decision and run with it. All right. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is C, a 43-year-old homeless man with a history of alcoholism. Clients who are economically disadvantaged, malnourished, and have reduced immunity, such as a client with a history of alcoholism, are at extreme high risk for developing TB. That is a part of health promotions and maintenance, y'all. Lower section on the NCLEX, anywhere from 9 to 12%. All right, but it's still very important. These are those questions that they give you. You should be like, hey, these should be like gimmies. Like you would think it would make sense, right? So let it make sense to you. All right, exposed to elements and immunodeficiencies. Yep, same thing. All right, appreciate all the follows. Tuberculosis, stop it. What's the biggest section? The largest section on NCLEX is management of care at 18 to 23%. Management of care. So you're the nurse taking care of 4 clients in the emergency room. Which patient should you see first, right? And if you're an LPN, the largest section is coordinated care. Essentially, it's the same exact thing. All right, here we go. Question 22. Virgie with a positive Maddox test result will be sent for an chest x-ray. The nurse is aware that which of the following reasons this is done: to confirm diagnosis, to determine if a repeat skin test is needed, to determine the extent of lesions, to determine if this is a primary or secondary infection. What are we thinking? What are we thinking? Shout out to all y'all, all 800 plus of y'all. Hey, I just want to let y'all know, the more people that are coming here, the more that y'all just motivate the hell out of me to just keep doing these, because I know that y'all love them and I know that these work. If you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, did my Code Blue TikTok bring y'all in here? I need to know, because it triggers me every time I hear that damn alarm. I swear to you. Also, make sure you guys like, share, and follow. All right. That is the trifecta. That TikTok and that I need to make sure it gets out there. All right. Appreciate you, Kevin. KY boy, mom. Hey, man, ma'am, I appreciate you. I'm an LVN. Shout out to you, Dustin. Hey, I don't care if you're an LVN or if you're an RN or if you're an APRN. You're still a nurse. You're still a nurse. Hey, CNAs, sorry, you're not a nurse. However, you are still very well appreciated, because I'm telling you right now, when I worked in the ICU, I wish to God that I had a fucking tech that worked with me. I promise you that. So shout out to all my LPNs, my LVNs. I love y'all. I love every single one of y'all. Let's find out our answer in 3, 2, and the answer is C, to determine the extent of lesions, right? If the lesions are large enough, the chest x-ray will show their presence in the lungs, right? Because you use that also as another way to not to diagnose, but to confirm. Right? There's also another way, but it's not the definitive way to confirm, right? So, reduction of risk potential, right? Smaller section. I refuse to believe this. Oh my God. Hey, so here's the thing. You can refuse to believe it all you want, but remember, if I gave you 100 questions and 9 of them were incorrect, right? 9 of them were incorrect. It still doesn't negate the fact that you should fail a test, if that makes sense, right? Hey, hold on real quick, y'all. I got to get somebody at 600. Because you already know the deal. Hey, if you come into my chat and you try to freaking like sell me nudes or want me to go to your stuff, why would I buy your nudes when I can get them for free? Anyways, here we go. Question 23. Kennedy with acute asthma showing inspiratory and expiratory wheezes and a decreased forced expiratory volume should be treated for which of the following classes of medications right away? Is it a beta blocker, a bronchodilator, inhaled steroids, or oral steroids? What are we thinking? Kay, thank you for the follow. Also, welcome everybody. Welcome. If you guys are new here, we're doing NCLEX questions. I got these questions off nurseslabs.com. All right, they're free sets of questions. Make sure you guys like, share, and follow. Hey, we need 40,000 likes, y'all. 40,000 likes. Why am I in the question? Oh, Kennedy. Oh, my bad, Ken. I don't know why. I ain't make the questions, bro. So I'm gonna give y'all 15 seconds. No, I'm gonna give y'all 10 seconds. No, I'm just gonna answer it now. Here we go. And the answer in 3, 2. I can't make my mind up, but hey, our answer is B, bronchodilators. Hey, physiological adaptation. Think to yourself, why is this considered a physiological adaptation? Remember, they cover acute, chronic, trauma types of questions, right? Physiological adaptation. So this person right here who is having these inspiratory and expiratory wheezes, that's an acute issue that's happening right now. Right? That's an acute issue. So that's how I know I need to take care of that, right? Bronchodilators are the first line of treatment for asthma because bronchoconstriction is the cause of reduced airflow, right? That's why. So when you think about these areas that they test you on NCLEX, think about the type of question. When you think about the type of question, you can know where it falls under, okay? You can know where it falls under. Albuterol for the win, right? Shout out to albuterol, right? You know, I was an asthma baby. I don't got asthma, but I'm pretty sure I'll get asthma later on. So, yes, I looked at the acute and it made me look. There you go, Mary. That's what I'm talking about. Here we go. Question 24. Mr. Vasquez, 56-year-old client with a 40-year history of smoking 1 to 2 packs of cigarettes per day, has a chronic cough, producing thick sputum, peripheral edema, and cyanotic nail beds. Based on this information, he most likely, keyword, most likely has which of the following conditions? Is it acute respiratory distress syndrome, asthma, chronic obstructive bronchitis, I got bronchitis, or emphysema? What are we thinking? Hey, if you guys are new here, welcome. I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, who you be and what you do. Everybody's saying I got some B's, I got some C's, I got some D's, mostly C's and D's. It says R, this is an acute, okay. Another one, PA, okay, shout out to you. LP in Ohio, HR assistant. Hey, look, HR, I'm gonna need for y'all to I understand that y'all are all about the company, you know what I'm saying? I understand. Catherine's in her last semester, ICU nurse from Jersey, shout out to Jersey. What else? X-ray tech, shout out to you. A or B or C. I need for you to pick 1 or 2, or I need for you to pick one or the other. Respiratory Indiana. I know some folks in Indiana. All right, y'all. Here we go. Here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is C, chronic obstructive bronchitis. Because of this excessive smoking history and symptoms, the client most likely has chronic obstructive bronchitis. That is part of physiological adaptation. Because remember, with physiological adaptation, it's not just acute and trauma. It's also chronic, right? And this is a chronic thing. My man's been smoking cigarettes for 40 years. So what you think the outcome's going to be? What you think the outcome's going to be? He's just going to be like, hey, yo, we Gucci out here. I can go out here and run a marathon. No, sir. No, no, no. It's not how that works. Not how that works at all. All right. Hey, physiological adaptation, 11 to 17% on the NCLEX. All right. Hey, I just want to let y'all know you will get easy questions on NCLEX. But think about it. If you get easy questions on NCLEX, you may not be doing so well because the NCLEX wants you to be more towards the application and analysis phase where you can use clinical judgment and critical thinking. All right. That's what it's about. All right. Here's our situation. Francis, age 46, is admitted to the hospital with a diagnosis of chronic, lymphocytic leukemia. The treatment for patients with leukemia is bone marrow transplantation. Which statement about bone marrow transplantation is not correct? So 3 of these answers are the correct answer, and one of them is not. So the one that is not is our answer that we want to choose. All right. This is why you have to RTFQ. What does RTFQ mean? I need somebody to tell me in the chat. Tell me right now. So A, the patient is under local anesthesia during the procedure. The aspirated bone marrow is mixed with heparin. The aspiration site in the posterior or anterior iliac crest. Read the full question. Sure, we'll go with that. The F stands for whatever you think it stands for. And the recipient receives, the cytosine for 4 consecutive days before the procedure. All right, RTFQ, that's what I'm talking about. You already know. Read the question, right? Right? We don't need to be explicit around here. I'm telling you something. For all y'all that are want to become nurses and you're just like, oh my God, I don't like curse words. Let me tell you, y'all got some potty mouths. Hey, look, I'm a sailor. I've been in the Navy for 16 years, y'all. And it's just like being a sailor. The F word literally is probably one of the best words, number one, ever created in the English language, but it's literally one of the words you hear on the daily when you're on the floor. B is incorrect. Okay, so what's the correct answer? Ms. Walker says, thank you. I appreciate you. Army vet, becoming a nurse. I use all words. Facts. Nurses cuss. Trust me, you will. Hey, so if you think you ain't gonna cuss, trust and believe. The F word gonna slip out and you're like, oh my God. Yep, that's you. Tracy, you know what's up. Here we go, y'all. Here's our answer. Here's our answer in 3, 2. My uncle's a CRNA and a Navy vet. Shout out to your uncle. Hey, I just want to let you know, Navy is the best branch. Yup. I'm only saying that because I've been in the Navy for so long. So shout out to y'all. Hey, I love all my branches. I love all y'all. Shout out to all y'all. So here, our answer is A, right? The patient is under local anesthesia during the procedure. Before the procedure, the patient is administered with drugs to help them prevent infection and in rejection of the transplanted cells, such as antibiotics, cytotoxic, and corticosteroids. During the transplant, the patient is placed under general anesthesia. Why? Because that shit hurts. Why in the world? It would say Air Force is the best. Look, okay. You're right about that. I ain't even gonna hold you to that because, the Air Force is like white collar. Everybody else is blue collar, it seems. And the Navy is the most forward deployed branch out of all of the branches. So, I can't really hate, but shout out to the Air Force. I worked with a bunch of the Air Force when I was a search tech instructor. But hey, reduction of risk potential. Go Army, beat Navy. Hey, we gonna see next month. I was gonna go to that game, but I'm definitely gonna go to it next year. Definitely going to it next year. Father-in-law was Air Force. Shout out to your father-in-law. All right, y'all. Hey, real quick, commercial break. Don't y'all go nowhere. Y'all better stay here and listen to me run my mouth some more. Hey, we're doing NCLEX questions. Make sure y'all participate. I'm kind of funny. Sometimes you already know the deal, baby. But make sure you guys share. Make sure you guys like. Make sure you guys follow. Hey, we need 50,000 likes. I'm an Army recruiter. Sorry. That, sir, I am sorry to hear. I actually got asked to be a Navy recruiter, and I was just like, nope. No, sir. Not my thing. But make sure you guys like, share, and follow. Give me all them likes. Make sure you guys share. All right. Don't be selfish your whole life. All right. Hey, don't troll my chat. I already had to ban somebody who was trying to sell me nudes. Why sell nudes, baby, when the internet gives them to you for free? I'm just saying. Hey, but don't do that. All right. Because I'll ban you. And I thoroughly enjoy it. Nurseslabs.com is where we can get these questions from. All right. They are free sets of questions. Go over there and check them out for yourself if you guys need them. 7-day NCLEX course. That is my course that I created. Projected to have over 150 videos in there. Right now, $48, and there's 50 videos in there. 50. That's going away on the 23rd at that time. All right. On the 24th, there's going to be a different one there. I'm telling you right now. If you want or need coaching for NCLEX, mentorship, all that good stuff, check out thebootnurse.com/coaching. All those links are in my bio, and we're going to do an Ask Me Anything after this. All right. Question 26. After several days of admission, Francis, remember Francis, y'all, from before, becomes disoriented and complains of frequent headaches. The nurse in charge first action would be to what? So based off of my patient being disoriented, aka an altered level of consciousness, and now has frequent headaches, what is the very first thing that I want to do? The very first thing, if you go systematically from 1 to 4, what's the very first thing, right? Call the physician, document her status in her chart, oxygen or raise the side rails. What's the very first thing? Hey, so shout out to all 700 of y'all that are in here. All right. I want to know who you are, where you're from, where you're at in your nursing journey. All right. And if you're not a nurse, who you be and why you here. You know, hey, we welcome everybody in here with open arms to trying to get their learn on. OK. Also, make sure you guys like, make sure you guys share, make sure you guys follow. Hey, we need 50,000 likes. Bella, if you're still in here, you're failing me right now. You're failing, girl. You're failing. Megan, you're about to be and graduate in 11 days. Shout out to you. That's right around the corner. Right around the corner. I'm going to give y'all 10 seconds, all right? 10 seconds, right around the corner. Hey, be proud of yourself. Hey, for y'all that are about to graduate, be proud of yourself. The endurance to become a graduate nurse and to get a degree is a long one. So congratulations to y'all who are about to graduate. Congratulations to y'all. Then y'all got one step. Y'all got one last step, and that's to get that license. Now, I'm telling you, that degree doesn't mean shit until you have a license. Trust and believe me, okay? All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is D. Raise the side rails, right? Why? Because it's part of safety, right? Because the patient who is disoriented is at risk for falling out of the bed. The initial action, meaning the very first thing that I want to do is that I want to raise the side rails because I don't want my patient to fall out of the bed. I'm telling you right now, you ever hear a patient fall out of the bed? What's up, Victoria? You ever see a patient or hear a patient fall out of the bed? Listen, that's the worst. That's the scariest shit that you ever hear. I'm telling you, it's scary. All right. So make sure you guys understand that safety and infection control, also 9 to 12% on the NCLEX. OK, super important. Remember, it's all about nurse safety. Nurse safety. Lamana from Jamaica. Shout out to you. All right. Here we go. AdPi. There you go. Never forget AdPi. AdPi is always going to be there. What's up, baby girl? I see you in there. Question 27. During routine care, Francis asked the nurse, how can I be anemic if this disease causes increased white blood cell production? The nurse in charge, best response would be that the increased number of white blood cells is what? Crowded by red blood cells, is not responsible for the anemia, uses nutrients from other cells, or have an abnormally short lifespan of cells. What are we thinking? Shout out to all of y'all in here. Shout out to all y'all about to graduate. Shout out to everybody that's about to take that NCLEX. Also, if you need NCLEX, hey, for $48, I'm telling you right now, the biggest flex that anybody could have would be like, hey, I got an NCLEX review for $48. I'm just letting y'all know right now. I'm just telling you because it's going to go away. And then I'm always going to have somebody like, hey, can you go back to that $48 price? Nah, no, sir. No, sir. All right. What are we thinking? 15 seconds, y'all. 15 seconds. Also, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Wife is an MP working on CRNA. Really? Why would she go be an MP and then go be a CRNA? Usually people that go be MP, they stay there. Hey, to each their own. I'm just saying. It says there's a bunch of us Florida peeps up in here. Shout out to Florida. Hey, I lived in Jacksonville. I lived in Duval. You know what I'm saying? I lived in Duval for like 4 years. You know what I'm saying? Shout out to 103rd, somewhere where I would never want to just go frequent. We call that deployment tourism. So here we go, y'all. Here's our answer in 3, 2. And the answer is, Palm Beach in the building. Philippines. Shout out to the Philippines. And the answer is A, crowd red blood cells, right? The excessive production of white blood cells crowd out red blood cell production, which causes anemia to occur. Physiological adaptation. Third largest section on the NCLEX at what? At what? 11 to 17%, y'all. 11 to 17%. All right, so that's McAllen. Hey, I've been to the Valley. I know a little something about McAllen. You know what I'm saying? I've been down there. I live in San Antonio, so I know a little something about the Valley. So physiological adaptation, y'all. Remember, chronic as well as acute trauma. Those are the kind of things that physiological adaptation covers, okay? You got accepted into your nursing program. That's what I'm talking about. Congratulations. Who said that? Who said that to me? Alicia, ma'am, I'm telling you right now. You need to get your time management under control right now before you start school. Be ready, because your first semester of nursing school is going to humble that ass. Trust and believe me when I say that. Uteska, nursing student here. Okay. All right, Eric. Okay. I see you out there. Get your nursing on. Question 28. Diagnostic assessment of Francis would probably not reveal what? Predominance of, was it the lymphoblasts? Is it the leukocytosis, abnormal blast cells in the bone marrow, or elevated thrombocyte counts? What are we thinking? LP and ER psych? You do it all? Oh, because there is an ER psych positions out there. I forgot. So there is out there. Hey, also welcome. Hey, we need 50,000 likes. Hey, we're like 3,000 short. Hey, make it happen. Make it happen. You just joined. Kristen, I'm glad that you just joined. Welcome. Hey, if you are new here, I want to know who you are, where you're from, where you were at in your nursing journey. Look, hey, Francis got a lot going on, Kristen. I don't even know. But she asked questions. She become disoriented. I really suspect that she got some dementia going on. She got a lot of shit going on. Shout out to the Philippines. I see you out there. Also, if you guys are new here or just here, make sure you guys like, share, and follow. That is the trifecta that gets it out to people. Make it happen. Make it happen. Leslie, thank you for the follow. Been a nurse for 10 years. Is it Alyssa? Shout out to you. Ivy from Chicago. Okay. 30-year nursing student from Jamaica. Okay. You're from Haiti. Okay. I had somebody from Nepal here. I had some people from New Zealand, so you already know the deal. Nursing all around the world. All right, mostly surgical. That's okay. Are you an OR nurse? You're an OR nurse. Shout out to all my OR nurses out there, because I'm an OR nurse, so you already know the deal. Hey, so the answer is B. Leukocytosis. Chronic lymphocytic leukemia is characterized by increased production of the leukocytes and lymphocytes, resulting in leukocytosis and proliferation of these cells within the bone marrow, spleen, and liver. That is the reduction of risk potential, right? Man, we got a lot of people from the Philippines up in here, so shout out to y'all. I love everybody from everywhere. I actually thought about going to the Philippines and like visiting or just going there on vacation. Hey, if I go there on vacation, where should I go? Surgical. Oh, I got you, Kim. I got you. So you said PCU, pre-op, OR, PACU. Hey, tell them about the OR and tell them about PACU. Hey, I think PACU is the holy grail if you want my opinion. I like the PACU. Here we go. Question 29. Robert, a 57-year-old client with acute arterial occlusion of the left leg, undergoes an emergency embolectomy, right? 6 hours later, the nurse isn't able to obtain pulses in his left foot using Doppler ultrasound. The nurse immediately notifies the physician and asks her to prepare the client for surgery. As the nurse enters the client's room to prepare him, he states he won't have any more surgeries. Which of the following is the best initial response by the nurse? Explain the risks of not having the surgery, notify the physician immediately, notify the nursing supervisor, or record the client's refusal in the nurse's notes. What are we thinking? Right? Emerald, appreciate the follow. Bees, thank you for the follow. Throw some bees on it. What else we got? So shout out to all y'all. Hey, y'all get me over 50,000 likes. I can't see. Hey, we have 51,000. That's what I'm talking about. Y'all keep, like, you know what? Hey, might as well just keep going. Let's go to 60. Get carpal tunnel out here. 10 seconds, y'all. Borg, thank you for the follow. Appreciate you. Let the doctor take that risk. I know that's right. All right, y'all. Here we go. In 3, 2, and the answer is explain the risk of not having the surgery. So this one, we're going to go back. I don't ever go back to the questions, but we're going to go back, right? But it says the nurse immediately notifies the physician, right? And asks to prepare for surgery, right? So this is one of those. Hey, hold on, Amina. Hold on. Right? This is one of those questions When you get the question wrong, this is why you read it. And if it still doesn't make sense, you're going to be like, okay, that still doesn't make any kind of sense, right? But in the reality, if the patient refuses, the first thing that you do is that you call the physician. You have to let the physician know. So this is one of those questions where I would omit this because that is incorrect. But remember, if I gave you 100 questions, Cherry, I understand it's not our job. You're right. It is our job to advocate. And that is a little dicey, right? But this is where you have to tell the doctor, hey, doc, so-and-so said that they don't want to go to surgery. Then what's the doctor going to do? They're going to come there and they're going to do it. And then you have to let the client know after that, but you can't assume the risk, right? You can explain the risk. You can explain the risks, right? Explain the risks, but you have to let the provider know. As in like, hey, if you don't get this, the possibility of you losing your leg is very, very high. But you got to let the provider know that this patient is is refusing to do it. So essentially, when the doctor tells them what the risks are, you do what? You reinforce what the surgeon says. Just like with an LPN and a CNA, they can reinforce teachings that the RN does when they do their assessment. Okay? Does that? Yeah, nurse responsibility is education. Facts. So that's why I say that. Did that make sense? If that makes sense, and if you guys are getting value, keep smashing that like button. We need 60,000 likes. Make it happen. Make it happen. Here we go. Here we go. Here we go. This is why I like doing this, y'all. This is why I like doing this. Question 30. During the endorsement, which of the following clients should the on-duty nurse assess first? So endorsement, I'm gonna reword this question. During turnover, which of the following clients should the oncoming nurse assess first? Does that make sense? Reword it so where it makes sense. Okay. A 58-year-old who was admitted 2 days ago with heart failure, blood pressure 126/76, respiratory rate of 22. Or an 89-year-old with end-stage right side heart failure, blood pressure is 78/50 and has a do not resuscitate order. A 62-year-old who was admitted 1 day ago with thrombophlebitis and is receiving LV heparin. Or is it a 75-year-old who was admitted 1 hour ago with new onset of atrial fibrillation, who is receiving LV cardiazem or diltiazem? What are we thinking? It's not B because of the DNR. Okay. What else are we thinking? Hey, if you guys are new here, we're doing NCLEX questions. All right. Got them off nurseslabs.com. Make sure you guys like, share, and follow. Hey, we need to get to 60,000 likes. Did you just spell girl with an H and a U? Girl. I hear you. And I see you. I see you out here. Oh my God. Keyword, new onset. This is why it's important that you read your questions and your rationales. I mean, your questions, your rationales, but you also, when you're at your questions, you read your question as well as your answers. They fit with one another. Monitor the effects of cardiazem. Okay. What else? I'm gonna give y'all 10 seconds. You guys are on a roll. All patients are stable except D. Okay. What else? Joanne, thank you for the follow. DNR doesn't mean ignore. That's true. It doesn't mean ignore. But what does DNR mean? What does DNR mean? Because of the new onset. Okay. What else? Atrial fibrillation. Oh my God. New diagnosis, check first. Okay. We got D's out here. Let you go. Oh, she's like, fuck that. If I die, I die. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is D, the 75-year-old who was admitted recently, 1 hour ago, with a new onset of AFib and who is getting cardiazem, right? A client with atrial fibrillation has the greatest potential to become unstable and is on an IV medication that requires close monitoring. That is part of management of care, the largest section on the NCLEX at 18 to 23%. Okay. Now think about this. If somebody has atrial fibrillation, I'm worried about heart palpitations, right? And what else can somebody develop with AFib? All right, Marcy, you know better. What happens when you change your answer? You get it wrong, right? Right? Clots, right? So they're also going to be on anticoagulants, right? Or they also could have a pulmonary embolism at the end of that, right? So you have to realize it's a new onset. It just happened an hour ago, and they're on a medication that requires titration. I didn't even know what test this is. Oh, this is just a comprehensive one, right? When a DNR is stated, you simply keep the client or keep the current correct. You are correct. Took my NCLEX yesterday, cut off, and got the good pop-up. All right, EMAC, hey, come back and let us know. On Monday. Yeah, but this is NCLEX for nursing, right? This is why it's important, right? You need to know who to go and see first. And this is why it's important you read your rationale, right? You read why it's correct, but then you also understand why these are incorrect. You may not agree with them. But I can tell you right now, out of 100 questions, maybe 5 to 10 of them are just going to be weird, right? But it doesn't negate and it doesn't allow for you to fail an exam. Okay, so happy I didn't have to take this again. Blah, 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 blah. Okay, got you. Tracking. All right, I can never get away. Look, Leilani, lay homie, you here with it, all right? You never getting away, ever, all right? So, management of care, largest section on the NCLEX, all right? Largest section, going for go to nursing school then? Hey, better go. You better go. Better go to nursing school. All right, y'all. Hey, and ladies and gentlemen, that is it for the questions tonight. Hey, but if you guys hang around, we're going to do an Ask Me Anything after this, okay? Oh, I'm in vet school. See, now that makes sense. That makes sense now. Hey, I appreciate everybody hanging out. I appreciate everybody participating. Y'all, we had 1,100 people in here at peak today. That's the most. Got it to 60. I love it. That's 1,100 people in here, y'all. 1,100. So I appreciate all the love, the likes, and all that. Like, I really, really do, because I'm telling you right now, I really love doing these, right? I'm a teacher at heart. I've been an instructor almost 8 years and never looked back. Love it so much. All right. Hey, I gave one person a 600 and I thoroughly enjoyed it, and I will do it again. I'm petty over 9,000. And once again, I got these questions off of nurselabs.com. You guys can go over there and check those out for yourself. The 7-day NCLEX course. As a matter of fact, I'm about to show all of y'all what it looks like. I'm going to show all of y'all what it looks like right now. All right. So here we go. So check this out. This is what the website looks like, y'all. And look, I'm not even playing. Before I turn this camera around, I want y'all to see what it is, right? It's only a limited time for right now, right? And there, of course, there's me explaining what it's going to be. And right there, you see it, $48, right? Until this day, it's going away and you get it. And if you're an early adopter, that means you get it for a lifetime. Did I say lifetime? Absolutely, right? You know what I'm saying? That's what you get. And yes, it is for both RNs and LPNs. I have both RNs and LPNs inside of this program, right? There's a little bit of the testimonies that are right there. And this is the stuff that you learn. The biggest thing is your mindset, right? You got to fix that. You understand the structure. We talk about critical thinking. Remember, critical thinking and clinical judgment is what the NCLEX is about. Okay. Pharmacology, third largest section. Management of care, largest section. Physiological adaptation. It is the third largest section. And we talk about NCLEX Day, right? And this is the curriculum that's going to be in there. Remember, I'm uploading stuff all the time. This is what the review consists of. Also, I have a path to conquer the NGN right here, right? This is already up. The NGN review is already up. It has 8 videos, y'all. 8. There's 8 videos, and each video is about half an hour long, because who wants to sit there for 2 to 3 hours looking through a review, right? Also, you get access to a Facebook page of other people. That's me when I worked at the Burn Center, y'all. And that's my little synopsis. Hey, remember, y'all, I failed my NCLEX 3 times. And this is why I do this. I do this because I don't want anyone to ever feel how I felt. Couple of testimonies, so on and so forth, frequently asked questions. And then the big question is, do I get my money back? You get to hang on for it for 7 days. If you don't like it, I'll give you your money back. Legit, right? Because I don't want you. If you don't want to be here, I don't want you here. All right, now here we go. I'm going to show you guys real quick of what it looks like. So over here, towards the left, you guys see that? This is everything that comes inside right now. That's what's in there right now. So we have a video on computer adaptive testing. Oh no. Yeah, hold on a second. Hold on. Let's see what we got. Hey, log me out. I'm going to show y'all right now. Don't go nowhere. All right, y'all. Here we go. Hopefully I didn't lose y'all. All right, so there's a video, computer adaptive, right? We talk about that. Let's see what we got. So, we go through those questions, and then over here to the side. So the passing rate for the review right now is, I'm working on actually coming up with a program for that, but I have over 200 people that are inside of the review right now, and every single person that has taken and used my review has passed. And that's over like 20 right now. And I also do the personal coaching, which I've coached over 100 people, and out of 100 people, literally like 4 didn't pass. And they didn't pass, and it wasn't my fault. So if you guys are looking for the links, those links are in my bio. Go click on the link tree, and it's the first 2, okay? And so look, we have the standard, the passing standard. We talk about that. Answering NCLEX style questions. We talk about that. Also, the PowerPoints that I'm going over, you get them. You can download them. They're yours once you get in there, right? But here's the kicker right here. The new generation NCLEX review, y'all. The new generation NCLEX review. I'm going to show y'all. That's what it looks like. Me down here in the corner running my mouth, if you guys can see it, right? And then and then we're going through the questions. I explain them. We talk about the rationales. That's why it's so important. I even talk about understanding the topics, right? And I even put the topics down here at the bottom for you, right? So that way you guys should be like, okay, now what is this question asking me? Like we talk about, different type of SSRIs, right? So this is I can't highlight it, but this is an SSRI, right? So the topic is, what are the signs and symptoms that I look for? What's the most important when I give somebody an SSRI, right? So it says, do I have case studies? Hold on. I'm glad you asked. Let me go back. Let me find it. Hold the phone. Right here. Right there, case study, right? I have a few case studies that are in here, right? But remember, on your NCLEX, your case studies are made up. You'll get at least 3 of them. You'll get at least 3 case studies, okay? And so with the case studies, you get essentially, everything that you need to know. I read these out. Right? You can go back and refer to them, right? And then once you go back and you refer to them, here's your next question. And it's 1 out of 6. And you'll see these pauses that'll pop up. And that is your chance for you to stop, go back and look and answer the question for yourself. And then once you come back from the pause, we go through the rationales and we explain it, right? And so that's for the first item, right? And we talk about why things are correct. And then you got your select all that apply right here, right? And then you got other ones. Like these are right here, what we call the close or the drop down, right? And so essentially this one's like fill in the blank type, okay? Anybody that's looking to get the 7-day NCLEX course, it is in the link in my bio. You can go up to it right now. Y'all, there's over 50 videos that are in here right now. And I'm projecting, I actually just sent an email out to everybody that's in the course right now. I'm working on the cardiology section, as well as I'm working through the 8 sections of the NCLEX client needs. So management of care, pharmacology, so on and so forth. But there is no expiration date. This is a lifetime access. Okay. That is my thank you for everybody investing in me and investing with everybody doing it. It looks extremely user friendly. It's very friendly. Very, very friendly, right? So, and this is another question, the question types is you need to, the prescription that's going to be given based off of what's in the case study. Is it anticipated or not anticipated, right? Are we going to, based off of whatever was given here, right? And this is somebody who has obstructive chronic or a COPD, right? Are we going to give antibiotics, corticosteroids, IV, so on and so forth, right? And so if we let it play, there's some other ones. As a matter of fact, let's go down to, we'll go down to number 6. Right. And look, all of these are less than 30 minutes. You want to know why? It's because I remember what it was like to still study for these. And who the hell wants to sit here for 4 hours, an hour at a time to just be like, yeah, let me sit here and just try to get all this knowledge. And then you get boring. Look, no, less than 30 minutes, less than 30 minutes. Get you some questions for less than 30 minutes. All right. And get your learn on from it. All right. So here's another one. Let me see if I can find it. I'm looking for the bow ties. Right. So here's another one where expected versus not expected types of questions. OK, you just got the review. Shout out to you, Tiffany. Since you just got the review, what I want for you to do is I want you to go through it and tell me if you see exactly what I see, and tell everybody right now in the chat if it's legit or not. Tell them, because you see everything that I see. Right. And then tell me and tell them, was it $48? It was. No, the thing about it, y'all, is just I had some people come up to me and they were just like, why are you scamming people? I was like, first of all, I'm not in your pocket telling you what to do. That's number 1. Second of all, don't come over here disrespecting me. Third, legit, I'm essentially doing this for y'all. Right. And I launched this course back in June, the end of June. Right. And it's come a long way, y'all. It's come a long way because of y'all's help. Because of the people that are already essentially in the course. Now look at that. Bow tie. Hey, Tiffany, go to NGN review number 7, right? And then go to the 1 minute and 10-second mark and tell me if you see the same exact thing, right? So here's the bow tie, right? Based off of the case study. What are we going to put there, right? What are we going to put there, right? So these are the types of questions that y'all will see on the NCLEX, right? You hate bow tie? Look, Bella, hey, you love them, you can hate them, but I'm telling you right now, you already know they on there, right? You know that they're on there. You know what I'm saying? So, and then afterwards, because you guys can see right here, the 7-day NCLEX review, this is where you guys are going to get a whole nother review. You guys are going to get a whole nother review. The site, what site is this? This is the 7-day NCLEX course. All right. And if is it Caribbean Bay? If you want to look up what the NCLEX course is, go check it out. That link is in my bio. OK, so it's thebootnurse.com/special. That's why it's $48. It's my pre-Black Friday / pre-launch special. But then down here, look, you get content like nurse prep, NCLEX prep, right? I'll bring it closer so you guys can see. But NCLEX prep, right? Talk about time management, lab values, legal. I already visited the site and planning to available before. Hey, on the 24th of November, the price is going up. I'm just letting y'all know right now. All right. It's going to go to $97. But still, even at $97 for you to have something unlimited for yours for life, and you're going to get all the updates, that seems like a no-brainer to me. Delegation and supervision, restraints, creating a study plan, right? Pharmacology. Y'all, look, there are 19 videos under pharmacology. 19. It says, hi, will this be good for me going back in January to start over my first semester? I had to drop one bad chick, ma'am. I can tell you right now, if you bought this for $48 and then you waited until you graduated school a year or 2 years from now, it won't be $48. So I think if you spent $48 right now to get you something that you know is going to be super beneficial for you later on down the line, that seems like a no-brainer. You know what I mean? It says, thank you, Kevin. You are already doing the Lord's work. Hey, look, I'm out here trying, right? And look, we got fluid and electrolyte imbalances, right? Fluid regulation, your hypos and your hypers, deep vein thrombosis. There's going to be 9 other videos going in here, y'all. 9. Endocrine. We talk about DKA, hypoglycemia, DI versus SIADH, hypo and hyperthyroidism, Cushing's syndrome, right? Bro, listen, I just called all of y'all bro, but listen, that right there, I'm just letting you know, that right there, $48. I literally had somebody come in here and tell me last time, they were just like, it's so underpriced that it's not even funny. Right. And I agree. But I'm all about building my community. I'm all about building y'all up. Right. And so that's why I'm saying, hey, get it while it's there. Right. It says, Kevin, what's your advice to do these last few days before taking my NCLEX? All right, Miss Mom, we're going to turn over. All right. So you guys see what it looks like. I'll turn it back over here in a second because I know some other people are going to look at it. And then also, of course, there's always ways to get support. And then, of course, if you guys have any other way if you're in the course and you have any other way to improve the course, let me know. Right. People tell me all the time, hey, can you improve the course? Or hey, can you put this? Can you do this? Blah, 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 blah. So make sure you guys check that out. All right. So now I'm going to turn this thing around so you guys can see my face because you guys got questions. But what's up? How are y'all? It says we'll be buying. Shout out to you. Okay. Hers cost us $250 for school. Might have been more. Hearst, I think it costs like, if I remember right, like when you have to pay for Hearst in school, it's like $250. But if you go to Hearst's 3-day review, I think it's like an additional, I think it's like $350. And sometimes it doesn't come with your tuition. All right. But hey, welcome. What's up? Shalom, Kevin. What's up? How are you? Is it Kadeem? How are you? Welcome. Look, hey, y'all see that? That's 63,000 likes. That's the most likes I've gotten since I've been on TikTok, and I've been doing TikTok for almost the last year. All right. We had 1,100 people up in here. That's the most I've had. Today has been literally has been like the best live that I've done. That's number 1. Number 2, shout out to all of y'all. I know a bunch of people left because, people come and they get what they want and then they leave. But listen, I appreciate everybody being here. A little bit about me. I have been in the Navy for 16 years. I was a surgical tech. I've been on 2 deployments. I've been an instructor. I'm still an instructor. I'm a master instructor as well. Been a nurse for 3.5 years, worked in ICU, burn ICU, neuro and medical, as well as I worked in PACU and I worked in the OR. I thoroughly enjoyed PACU, like the OR, 1-to-1 ratio. It's great. Also, I do this course. I failed my NCLEX 3 times, y'all. 3. And I never want anybody to feel how I failed. I even made a video talking about how I failed NCLEX and how I eventually passed in that. And that's over there on my YouTube channel. You guys can go check that out as well. It says newbie. Promise. I appreciate you. Thank you for the follow. What is the site? Cat Sky. You can go check the link out in my bio. The link in my bio, it's labeled the 7-day NCLEX course. Okay. Or if you want the website, it's thebootnurse.com/special, kind of like me, because I'm super special. So it says, hi, what we talking about? We're talking about NCLEX. We just got finished doing NCLEX questions. We're talking about my course. We're talking about coaching. And now essentially you guys are asking me whatever you guys want to ask. That's crazy. I never see your TikTok videos but I always catch your lives. My TikTok videos are in there. I don't upload as much as I should, but I'm going to start uploading more, especially when I'm talking about questions. So there's that. But somebody asked, what's some advice before you take your NCLEX? So number one, the day before your NCLEX, don't do anything, meaning relax. Don't do anything. Because if you don't know it by now, you don't know it at all. I had an old instructor tell me that. Okay. Megan says you graduate in 7 months. Ma'am, well, I'm glad you're here. Stay here till graduation. Stay here until you become a nurse and you're going to be Gucci out here. You know what I'm saying? Did you just end? So probably ended about 15 minutes ago with the question. So, hey, we do questions every Monday, Wednesday, and Friday at 17:30 or at 5:30 Central Standard Time, depending on who you are, right? How long have you been an RN? I've been a nurse for 3.5 years. I've been a nurse for 3.5 years. I've been a surgical tech for 13. I've been in the Navy for 16. So I'm kind of well-rounded. You know, I failed my NCLEX 3 times as well for LPN. Hey, that's okay. I failed my NCLEX 3 times, passed on the 4th. That's why I started coaching, is because I want it to be relatable. Even if I passed it on the first time, I think I still would have been coaching because I love being relatable and I love teaching. It's what I love to do. You can ask people who DM me. I'll give you an example. Miss User 57, she DM'd me and she asked me a couple of questions, and I have no problem answering questions. And she knows that I'm very responsive to those questions. So that's why I like doing it. I love coaching. I love mentorship. You know, coaching and mentorship, especially mentorship, is something that is very pushed upon us in the Navy, in the military, because, you know, you got to learn. You got to learn, right? You got to be able to give back. So I failed my NCLEX PN 3 times. Last time I took it, it was 12 years ago. I retake it this Tuesday. That's right, boy, mom. You were the one who asked me that. So you're going to go in there and you're going to keep it positive. All right. One thing I want you to know is that you failing is a part of your story. It's a part of your journey, right? That's what makes you a boot nurse, right? Is because you don't know nothing about nothing, but we're always gaining the knowledge, right? We're unsuccessfully successful, right? You have a mind shift change. Think about where you were 12 years ago. Think about your living status. If you were a single mom or if you were jobless or whatever you had going on, you know. So think about how your life was then versus how your life is now, how much more mature you are, your mindset, your thought process, all that plays a factor. All that plays a factor. It says, is it Ricarbro? Ricarbro. Hi, my NCLEX is March 18. Can you please recommend the preparation book? So Ricardo, you can check out the 7-day NCLEX course. That link is in my bio. Click on it. It's for $48. Once you get it, you have it for a lifetime. That means you get all the updated videos that are going to be uploaded in there. Right now, there's there's an NCLEX generation review that's in there with some tips and tricks on how to help you, as well as there's content videos in there as well. It says, where did you get your RN? I know I need to go back to school. I got my RN at Texas A&M. I took CT job now at 3rd ED, graduated in May with my BSN. Do you think I have options to travel after? Yeah, absolutely. I tell people that want to travel, give yourself a minimum of a year, right? But if you want to be completely honest, I would rather you have 2 years of nursing experience before you go and travel. Because when you travel, and if I have any travel nurses in here, y'all can attest to this. When you travel, they will give you the shit show patients. They will give you the hardest patients because you're there traveling. You get more money than them, so they throw you to the wolves. So before user 28, before you decide to take that leap, make sure you have ample knowledge before you start traveling, okay? Opinion of a new grad starting in a surgical ICU residency. Do it. Done. Do it. 100%. Do it. I wish LPNs could be grandfathered in. I'm not going to lie. Yeah. But the scope of practice is different. The scope of practice is increased. Ricardo, you're welcome, sir. Due to the level 3 ED. So my recommendation, if you can get to a user 28, if you can get to a level 1 trauma facility, that's where you need to go. What about the exit HESI? I take mine on the 22nd. What about it? Is it Estefina? What about it? I've gained so much more knowledge working as a certified medical assistant since I took my last NCLEX. You want to know why? It's because now you're surrounded around the people that you want to be like, that you want to emulate. And that's the one thing about what I like to call a tribe, right? If you want to be like the people that essentially have accomplished a little bit more than you want to emulate them, ask them questions, and surround yourself around those people. Remember, you're the average of the 5 people you hang around. Okay. Emily says, do you know people with back issues getting into nursing? Me. I have back issues now because I fell at my nursing job. But yeah, there's an ICU nurse that I've met plenty that hunched over that have back problems. So, but then again, you could be a nurse and not do bedside. RN and LPN does not equal bedside. You could be nurses working in clinics. You could work fucking anywhere. Absolutely. The shit show patients, right? Oh, Army nurse. Oh, yo, she in here. I ain't talked to her in a while, but she will tell you. Are you coaching classes as well? I only do coaching for NCLEX at the moment, right? And so if I started doing coaching for classes, the packages that I provide would be a little bit different. They'd be a little bit different. But I mean, people ask me for it all the time, so I may just do it. I'm worried at being at a level 3 since it's less acute. Level 1, yeah, user 28, you need to go to a level 1 trauma facility for sure. Definitely get that learned on. Any tips or recommendations on what to study? Estefina, I forgot what you had asked me, to be honest. I think you were talking about the HESI. You were talking about the HESI. I start LVN school and you're nervous. Is it Dior? Dory? There it is. Dory. One thing I'll tell you is it's okay to be nervous because your first semester is going to humble you. So time management is what you need to get into your head right now. Think about everybody that you hang out with and then don't hang out with them because that's what your life, you're about to eat, breathe, sleep, shit, nursing. That's about to be your life. So be prepared for that. Medicaid. Oh my God. Hey, that's the best name I've ever seen. That's the best name I've seen today. Is it bad that I've learned nothing new in a bridge program from medic to RN so far? So based on knowledge, not so much. But when you get the responsibility of having a patient by yourself at a different level of learning, that's a different story. And it also could depend on the facility that you're at, so on and so forth. Okay. So Medicaid, Medicate. How do I pass my pharmacology? I'm not doing well as an LPN student, please. So you need to know your family name and your suffixes, right? Example, cardiac meds. So cardiac meds, what's the umbrella? What falls under it? ACE inhibitors, sartans, or ACE inhibitors, your ARBs, of course, your calcium channel blockers, DIG, nitroglycerin. You need to know what the signs and symptoms of those are when you give them to patients, but then you also need to know about safety implications, right? You need to know about potassium. So take that same thought process and then think about antifungals and then think about antivirals. Beta blockers, they all end in LOL, and every beta blocker is a LOL. Every LOL is a beta blocker. That's how you have to think about it. You have to practice. And another way I would say Somalia is to use flashcards. Flashcards didn't work for me, but use flashcards. I know that works a lot for people. Damn, I have scoliosis though, and never had surgery. And I know clinic is possible. So Emily, you most definitely can do that. Nurses in school and health insurance companies. Yep. You can definitely be a nurse, but a lot of those places want you to have experience, but who's to say that you shouldn't apply? I always tell people to apply for those jobs. Always. Eric says San Antonio here, University Hospital or Methodist system better in your opinion? Go to university. Eric, do you hear me? Eric, I said your name 3 or 4 times. Hear me. Listen to me, Eric. As I am telling you this, take that ass to university. Go to university. Okay? Just give me a salute, give me a thumbs up, do whatever. Hello, Kevin. It's your favorite med-surg nurse. First of all, Heather, are you my favorite med-surg nurse? You all right, Heather? You all right? You all right? Hello, heard that, sir. Thank you. I'm just letting you know. Because, hey, at university, you get everything under the sun. They have a really good residency program. They have residents, right? And they're a community hospital. You know what I'm saying? At university, you'll probably get paid a little bit less. But I'm telling you right now, hindsight's 2020. If I could have done it all over, that's exactly where I would have went to start off. What do you think about accelerated nursing? You mean like accelerated nursing programs? I was in one, and I think it's okay. Now, there's some of them that are really fast, like Texas Tech has a 12-month accelerated BSN program. To me, that is absolutely insane because that's a lot. It's doable, or else they wouldn't have it, but it's a lot. I did an 18-month They have other ones out there that are 15-month accelerated BSN programs. So it all just depends. It says this: as a paramedic, I teach new grad nurses things daily in the ER. All right. So here's the thing I'll tell you, Kate, is when I was a corpsman and I worked in the OR and I worked in the ER as well, and I worked on the patient floor or the ward. Absolutely. You teach the nurses. You teach all the new grads because you have what they call corporate knowledge. You know, you have the hands-on. They don't get it. You don't get it a lot in school. And you being a nursing student now you'll be able to see that. You know what I mean? And so, of course, that's what happens. But trust me when I tell you, as somebody who was a corpsman who's been deployed twice, you know, who was really mean to nurses and then became a nurse. When I became a nurse and I started working on the floor, my ass got humbled a lot. So, yes, you will teach the new grads for sure, right? But I can tell you right now is definitely think about that on a humbling standpoint for yourself, okay? Let me see what you said. Were clinicals pretty spread out? Clinicals are spread out based off of the semester that you're in. So I did clinicals every weekend. I had a full-time job. I was a surgical tech instructor, so I had a full-time job. I worked Monday through Friday, and then Saturday and Sunday I had clinicals, turned right back around to go to work. And I did it every semester for 18 months. So it's doable. Quick question. Why don't RNs get trained on IVs or how to read EKGs? That's not true, Kate, because they do. However, you can get trained. Like, here's the thing is you can get trained on how to read EKGs, right? But if you don't see EKGs all the time, like if you work on med-surg floor, right? You don't have the EKG monitors right there in front of you, right? EKG monitors are very prominent in tele and ICU and ER. But on some floors, they don't have those. A lot of floors, they don't have them, right? And so you got to think it like if you don't train on them, if you don't see them, you don't know. You know what I mean? So like, here's the thing. I knew how to read EKGs okay, right? But I didn't become very good at reading EKGs until I was in the ICU for like almost 9 months because I literally used to just stare at them all the time. And I'm just like, oh, that's a PVC. I was like, oh, that's a run of VTAC. Oh, okay. Like I would say these things out loud. So some people are just not good at specific areas. And so that's what you need to realize as you start. You got to realize is that not everybody is going to have the knowledge span and the corporate knowledge of doing hands-on stuff like you. Okay. I am tired of CEOs of hospitals who have zero clinical experience. Also, CNOs are not included. Yep. That happens all the time. All the time. Have a good one. Gonna start showing up since I found you. Appreciate you, man. I appreciate you. Graduate May of 24. All right, man. I'll see you there. Is a 400 blood sugar dangerous? I don't know. Grizzly, you tell me. It says people tend to bully new nurses and then got the nerve to talk about short staff. Facts. It says New York, they don't. New Jersey, they don't learn that. Yep. It's a 4. Yep. You already asked me that. And I don't know, Grizzly, if you're in here asking about medical advice, don't ask medical advice in here or I'll ban you. All right. If you have any questions about anything like that, you need to call like the nurse hotline or you need to go to urgent care. You need to go to the ER. Okay. Jordan says a ton of hospitals are trying to go EKG on every floor, at least in Ohio. Well, I can tell you right now, a lot of hospitals right now, they won't put them in there. They won't put them in there because it's weird. By putting them on an EKG monitor, the insurance companies charge them for that. And then they're going to be like, well, why did I get put on an EKG monitor? And then, it's a mess. It's a mess. Emily says, do you think it's bad if I do a AUA and didn't take it seriously when most of the skills are like RN? What is an AUA? Why don't you be a doctor? Why don't I be a doctor? So I actually wanted to go and be a doctor. But number one, it's not everybody's calling to go and be a doctor. And here's the thing. Doctors are about the medical aspect. Nursing is patient driven. And I'm a very people person. I've been around a lot of doctors my entire adult life and career. And I realized that becoming a doctor was just not something that I wanted to do. So if you want to be a nurse, make it happen. If you're a nail tech, hey, if you want to be a nurse. So if you want to be a nurse, you need to make it happen. Okay. But TikTok. Hopefully that answers your question. Not everybody's meant to be a doctor. Not everybody's meant to do the things that they do, right? I became a nurse. I realized that I like nursing, but I also realized that I don't like working bedside. I do love the patient interaction, but I don't like how hospitals treat nurses. I don't. And so I'm not going to stay there for that. Is it a science part of it? Yes, there is very much a science part behind patient-driven evidence-based practice. So we do a lot of things that are non-pharmacological before we get to the pharmacological aspects. We also have our nursing diagnoses because as nurses, we can't make medical diagnosis unless you have the credentials to do that. Such as a nurse practitioner, they can make medical diagnosis because they're credentialed to do so. But as a nurse, I can't say that a patient has pneumonia because that is a medical diagnosis that comes with a plethora of different things versus I can say, an impaired gas exchange. Right? Because there is an issue with gas exchange or with pneumonia, I could say risk for an increased risk of infection because pneumonia is a bacterial infection that's in the lungs. You see what I'm saying? So there very much is a science behind it for sure. I eventually want to be an MP. We'll make it happen. It says, do you plan on going MP or CRNA? Kate, I actually was going to go for CRNA. But then I realized that I didn't want to go back to that much school. I've had a lot of things happen to me in the last couple of years to realize that I love the teaching aspect of school. Oh, I'm sorry, I love teaching, but I just don't want to go CRNA. CRNA was my thought process for a long time. Nurse practitioner, I thought about it too, and I was like, nah, I don't want to do that either. Shannon says, you can do it. I went back to school to be an RN at 44. It says being a single mom of 4 kids. Shout out to you. I know that's a lot because kids, hey, I have kids too, and FTK. If y'all know what FTK is, give me 70,000 likes. But hello, just got here. What are we talking about? Nancy, we were talking about NCLEX questions. We do NCLEX questions every Monday, Wednesday, Friday at 17:30, as well as we're doing an Ask Me Anything. So this is for nursing, nurses, NCLEX, essentially, just having a little conversation. That was my struggle going from ambulance to ER. Can't give what I want and can't diagnose. So here's the thing, Kate, is that even though you can't give and you can't diagnose, you still had to work under the supervision and the license of a medical doctor, even though you could do it with your hands. Like you can intubate. I know you can intubate. I know you can I know you can drop pressors. I know that you can drop paralytic. I know that you can do all of that. Sedate and intubate, baby. I know that you can do it all, right? But as a nurse, without the credentials, you can't do it. It's different when you're in a rig. Trust me, trust and believe me. I understand that. Aaron says, I start nursing in January. Shout out to you. K-Way, thank you for the roses. Thoughts on PA physician assistants? Go do it. My buddy, I have 3 or 4 of my buddies that are in PA school right now. Oh, I'm sorry, that are PAs right now. And they love it. It all just depends on fuck them kids. But it all just depends on you. There's different aspects of medicine. What do you think about the new NCLEX? I like it. Hindsight's 2020. I've been a nurse for 3.5 years, and I've been coaching for 3.5 years. Hindsight's 2020. I like the new NCLEX. I like it. Sweet. I'm 2 weeks away from finishing my first semester. Nancy, congratulations. Getting through that humbling phase of nursing school. And now it's just smooth sailing from here. It's really not. It's just going to get harder. But definitely be ready for it. Congratulations on almost finishing. What do you think about going from RN to PA school at 30? So my question is, why go be a PA and not just go to be a nurse practitioner? They essentially have the same credentials. Actually, as a matter of fact, I think if I'm correct, an MP actually has more credentials than a physician's assistant. It says, how do you get into the medical field without credentials? Do you have to volunteer? What do you mean? What do you mean? So essentially, like, everybody in the medical field has to have some type of credentials, right? Even if you're a CNA, like, you have to be certified. Like, you go through a certification and all that other stuff. They can hire you and you can work towards your certification, but there's no way that you don't go through some type of certification, because then the hospitals or the places that you work for, they're going to be held liable. So they have to be able to be like, hey, they meet these criteria before they start working here. NP, you have more autonomy. Yeah, you have more autonomy versus a PA. That's exactly what I said. So thank you, Sammy, for that. I'm keeping my medic once I get RN. I'm thankful you know scopes of us. Some RNs don't know. Well, that's the thing, Kate, is like, I know is because I have a different an umbrella of amount of things that I've done. Like I've done flight as a corpsman when I was deployed in 2012, 2013. Like we had a flight nurse, we had a flight corpsman, like we have all those things. So I understand the scope of practice. I've intubated before, when I was deployed. I've done a whole bunch of other things. So I understand that aspect of it. But you got to think it's just like being in a hospital is very different from being in a moving vehicle, right? Where where split decisions have to be made to save somebody's life. You know what I mean? You're welcome, Nail Tech. You're welcome. Kayla says, I'm going back to school for LPN. I've been in and out. I'm ready. RN. My ankle is broke. Well, I need for you to tape that shit up, and I need for you to get to stepping. Hey, tape it up and get back on the field, Kayla. Come on now. Come on. Lifestyle, thank you for the follow. Can you please say the days that you go live again? I go live Monday, Wednesday, Friday at 5:30 Central Standard Time, Texas time, because that's the only time that matters, baby. Okay. Also, if you guys are looking for a review, 7-day NCLEX course, listen, it's for $48 for a lifetime, and you get all the updates, right? All the updates. It's going away, y'all. It's going away on Black Friday. I'm telling you right now. Are you pursuing a teaching degree? Sammy, I am. I'm actually going to go get my master's degree in education. Were you blue or green side? I was mostly blue side, worked in hospitals, but my first deployment was to Gitmo, and my second deployment was to Afghanistan, and that was IA, but it was Army, we had some Marines, and we had a lot of coalition forces, so I was with some Australians, some Italians, Slovakians, we had some Singaporeans there, so I did a little bit, right? I didn't go green side. Hola, what's up, Leslie? Shout out to Texas. You know the deal. What's your opinion on charge nurses placing new grads in trauma less than 6 months? What do you mean? You talking about what do you mean? $48 for what? Isaac Benjamin. So my NCLEX course is $48. So anybody that's interested in an NCLEX course to help you prepare to take your licensing exam, that link is in my bio. It's for $48. Thank you for your service. Appreciate your support. Thank you. Are you going to be a clinical instructor? I've tried. I've applied at different schools to be a clinical instructor. I was actually a clinical instructor. I was a clinical instructor / clinical coordinator for my surgical tech program when I was an instructor, when I was active duty. And I applied for being a clinical instructor, but civilian hospitals are weird, man. I mean, civilian schools are weird. They don't want me there, so I'm on. All right. Apply for technical colleges as an adjunct for PN to get your foot through the door. Already tried. The best nurses were in healthcare prior to doing RN, whether CNA, MA. Yeah. So for the most part, yeah. That's because they already have that corporate knowledge. They already went through the struggle of kind of understanding the realm of what they're getting themselves into. Would love to see a man for once. What you mean, Terrell? Is it or Toriel? What you mean? Which is harder for you, NCLEX or the HESI? The HESI was harder. The NCLEX was difficult because I didn't know how to even do it. I didn't know how to do it. Once I figured out how to do it for myself, then yeah. Did you get your Voc Tech? What is that? So I'm a master instructor in the Navy, right? And that equivalents to a post-secondary instructor as a civilian certification, and I have that as well. So when they say that I'm Navy and I have all that, I have all that. You know what I'm saying? That's very reassuring. Yeah, the HESI and ATI, all those things are hard. They're meant to be hard. I did CNA, EMT, and then medic. It's hard for me to ask for help when I'm drowning. Any tips? Ask for fucking help. Let me tell you something right now. No amount of fucking certifications or any experience that you've had being a CNA, an EMT, or a fucking medic, if you need help, open your mouth. A closed mouth doesn't get fed. Because guess what? If you stay there by yourself and you don't ask for help and then something happens, then what? Then you're going to be up shit's creek without a paddle. You're going to be like, fuck, I wish I would have asked for help, so on and so forth. Okay? That's just, I'm just being completely honest with you. Let me see. Clinical instructor. I know Toriel asked me a question. Oh, you would like to see a man as a clinical instructor? Trust me, Toriel, I've been trying. So I was an RN on a split for 10 months. They threw my ass on the charge nurse. Look, that's wild. That's wild. You have to apply for vocational certification as a nurse to teach. Look, Sammy, at this point, I don't even care about teaching in anybody's institution. I would rather talk like this and teach people. I get more responses and I get better feedback from doing this on TikTok than having to go through somebody's stuff and then have to jump through all these hoops. You know what I mean? I got my BA in mass communications 10 years ago, trying to go back to school for nursing, and it's kicking my ass. It will kick your ass. It's a little fee and well worth it. It opens doors for you to teach. But the thing about it is, like, I don't necessarily need all of that for me to teach. If you want me to teach formally on a podium, which I've done before, I can do that. But I just don't even want to do that anymore. I don't even want to jump through those hoops. 49 years old. Four kids, grown, two nurse, one Navy son, and now it's my turn. I graduated in May. That's what I'm talking about, Sky. That's what I'm talking about. You got to have a backbone in healthcare. You really, really do. You say I'm swamped. Get me somebody now. Facts. I guess my thought is I don't want to be a burden. Let me tell you something right now. Somebody is always gonna fucking complain. No, Sammy, I appreciate your help. I'm not like dismissing the information that you're giving me. I promise you that I appreciate the help. It's just that when you start to do it so many times and then they're just like, nah. And then when you realize that you can make a bigger impact doing other things, there's no need for me to go that route. You know what I mean? So, yeah, it says, I guess my thoughts is I don't want to be a burden. I help others, but my ED is so lazy and don't help. So that's the thing, Kate, is that's just sometimes that is the culture of it. I remember I asked somebody to help me turn a patient and she literally was standing there in my doorway. And then I was just like, hey, can you help me turn her? And she was like, oh, I don't work on this floor. And I was like, I didn't ask you if you worked on this floor. I'm asking you, can you help me turn her? I'm not asking you to wipe her. I'm not asking you to change her. I just want for you to help me turn her because she's 300 plus pounds. And then she was just like, looked at me and I was like, you know what? Never mind. I got it. And then she was like, no, I'll help you. But it's shit like that that's annoying. And so I will burden everybody because I'm telling you something right now. This back ain't going to be the back that it's going to be later on. So don't you do hospital nursing? I do hospital nursing, yes. Thanks for helping these new folks. Absolutely. Just failed out of my nursing program by 1 point. Very discouraging. I'm guessing you mean any tips? I would appeal it. What do you look for in a man? Talking about me, Jesse? Well, he has to be at least taller than me, dark and handsome because he needs to be that tree that I climb. So I said what I said. No, I'm just playing. What's up, Sky? Okay, Sammy. Hey, cool. Sammy, as long as we still vibing on the same page, I got you. Doing LP in the RN program. I can't wait until the NCLEX time to use your content. Toya. Was it Toya? Shout out to you, ma'am. I appreciate you. But you're smart and you know different fields. Tech school will be easy. And while you're going, I don't disagree with you. Trust and believe me, look, let me tell you something right now. When I'm at the hospital and I see a bunch of students, it's like a gravitational pull. It takes every ounce of my being to not go around them and be like, hey, what are y'all learning? What are we talking about? We're talking about case studies. Oh, we're talking about this. Talking about nursing diagnosis. Hey, let me see that. Let me show you. And then it takes everything I have for me not to do that. But I do it all the time. And then I end up meeting a bunch of great students that are out there that are going to do great as nurses. So it's the same. I asked the RN to start a heparin drip on a patient because I can't. And she was just like, that's not my patient. Yeah, I can see that. I agree. We're here for 12 hours. You're helping me. Facts. What item your NCLEX stop? What you mean? I don't know what that means. We need instructors. Sammy, you are right. We do. So you know what really trips me out? They say that we need instructors, but then when instructors apply, they don't call them back. That's my issue. That's always been my issue. Tip, doctor writes an order. It's not right. Refuse. I did. Patient died with the next RN. What do you mean, Trace? Like, as in they wrote the order, you refused to give it? Was the order like out of range or what? Same here. That's why I love teaching. I got you and I understand. All right, user 57, you have a good night. It says, I love those type of nurses as a student. I love it. It takes every five. I'll be like, hey, what are we talking about? We talking about NCLEX? We talking about this? We talking about that? We talking about this? We talking about that? ER and all floors is a 24-hour job. It's not up to one shift to complete everything. It's not. It says, yep, I did not give it. No pre-magnesium level. Heart exploded. Wait, so you mean to tell me that the doctor wrote an order for to give magnesium without a lab draw for the magnesium levels and the nurse gave it blindly? Is that what you're telling me, Trace? I'm a CNA starting ADN in January. Any advice for me? Taurus, I would recommend that you get your time management down now. Also, I would recommend buying my 7-day NCLEX course for $48. That's what I always say. But if that happened, Trace, you already know what's going to happen. You already know who's at fault for that. You know who's at fault for that. But you know who's going to get in trouble. And you know who's going to lose their license. It's definitely going to be the nurse. Because that's one thing I'm going to tell y'all, and I hope if Kate's still in here, is like that's that's another thing about medical administration. Like, you can understand your medicine and all the other stuff, but I'm trying to tell you, these doctors will write some fucking crazy ass orders, and you gotta look. I had a doctor who put in an order for 50,000 units of heparin, y'all, like to give to the patient, like not CRT, and I was like, hold up, what are we doing here? You see what I'm saying? You got to know your scope of practice. And and the thing about it too is like, this is more going towards Kate, is you need to know more of the whys. And as you start to increase your medicine, your medical professional knowledge, whether it be as a paramedic or as a nurse, or if you go NP, or if you decide to go doctor or whatever, you definitely will understand more of the intricacies of a why. Who said that? Euphoria. You said why? Why what? MD lost license and the nurse and the RN good, as they should have. It's just like, why would you write an order for that? And then as the nurse, this is why I love nursing, is that you can really check some doctors. You're like, why would you write that order? You know what I mean? I would have refused. I've refused orders before. And I'm telling you right now, don't you ever be fucking scared to refuse an order if you know it is out of range. If you know that it's not warranted. Why are you writing that order? Most doctors will tell you, hey, think that's a good catch. It's been a long day, yada, 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 blah, blah, blah. Yo, cool. I understand. That's what we call a near miss, right? That nurse will be the one. Yep. That nurse will definitely be that one at fault. Anybody ever heard of Redonda Vaught? Anybody ever heard of Redonda Vaught? She worked at a university of fucking, or Vanderbilt University, gave somebody Vecuronium when she meant to give them Versed. Medication era, ended up killing the patient. A 75-year-old woman going down for an MRI or a CT. She gave him Vecuronium. You see what I'm saying? That's why you need to pay attention. Fun fact, pressing on the liver makes the EJ pop more if you're trying to get it out. That is a fun fact. That's a good fact, actually. Just talked about her in class. I actually talk about Redonda Vaught inside of my course, where we talk about, what is it? It's legal. Yeah, legal rights and responsibilities. I talk about Redonda Vaught, about why it is important that you understand medical administration and medication errors. Because I'm telling you right now, you see what that hospital did to her? They threw her ass under, like she got in trouble, lost her license and everything. Once somebody whistle blew about the hospital throwing it under the rug, they brought her back. And then the hospital was like, oh, no, that wasn't us. That wasn't us. But the hospital, settled it out of court, paid that family a lot. But then somebody whistle blew and it got to other people, and then they brought her back. So many things wrong with her case, but ultimately her fault as well. That's one heck of an error. Facts. That is 100. So here's the thing. Is that her fault? Absolutely. Like, especially when you realize that they were overriding the Pyxis, or the medication dispensing machine, for people that don't know that. And it's a norm. It's a norm in that hospital for them to have done that, right? And then the thing about Vecuronium is that it has to be reconstituted. It's in a powdery form, and it has a yellow tab on the top with like a red sticker, and it says warning, paralyzing agent. It says it on there. And then you have to reconstitute it. And then when you scan it, it'll tell you this is not in the patient's record, blah, 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 yada, yada. Like, there's so many steps that happen in between there. And she still gave it. And I know at one point she was trying to fight to get her license back. Ma'am, absolutely the hell not. You are not getting that license back. No. Because best believe, if my black ass did something like that, buried. Trust and believe me, right? So this is why it's important for everybody to know the why. Know your scope of practice, because in the end of the day, those hospitals will throw you under the bus. And then some lawyer, you're going to be standing in a courtroom, sitting on somebody's stand, and some lawyer is going to be ripping you the fuck apart. So you have to be careful. If you guys are finding value, smash that like button. Give me the 70,000 likes. Stop playing games with me. All right. Scary for nurses when reporting medical errors. It is very scary for nurses to report medical errors, right? Because you already know, it's like, if you fucked up, that's it. It says, to be fair, it was totally preventable. If the patient was on monitors, etc., simple ventilation fix. However, they were like on a med-surg floor. There's no, first of all, Vecuronium should not have even been on their floor unless it's in an SSRI locked type of box for if there's a code. That's the only time Vecuronium should be accessed unless you're on a floor that needs it, like the ER or the ICU. You know what I mean? Took my NCLEX last week and I passed. Going to the NICU. Shout out to you, Pew Pew. Pew, pew. Everybody show Pew Pew. Show Pew Pew love. Tell them congratulations. Or her. Him, her. Whatever. Tell them congratulations. Welcome to the greatest shit show on earth. What type of nurse are you? And what type of what kind of information can you give us? Like, let us know. Like, what's a tip? You know? What's a tip that you can give us? Also, if you guys are new here, welcome. We're talking nursing just about everything. Talking about the NCLEX, which is the nurses and licensing exam. Also, I do NCLEX questions every Monday, Wednesday, Friday, starting at 5:30 Central Standard Time, Texas time, baby, because that's the only time that matters. So, also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. I'll be hanging out probably for about another 15 minutes. Also, if anybody is interested in an NCLEX course, I have an NCLEX course, y'all. It's for $48 right now. $48. And I'm going to show you guys what it looks like real quick. For all those that are interested. Also, if you're about to start your nursing program, like you're going to start nursing school, this is perfect. It's also for RNs and LPNs, okay? RNs and LPNs, right? So, hey, it's going to end in 6 days, 4 hours, 9 minutes, 30 seconds. All right. So it's an on-demand course, right? It's for RNs and you get it for a lifetime. Yes, I said you get it for a lifetime. All right. San Antonio RN BSN. Shout out to you. All right. And yes, you get it for $48. Look, y'all, the normal price when it comes out, it's going for $347. All right. And it's expiring. How long did you wait before taking the NCLEX? I took the NCLEX immediately after I got out of school, but I failed NCLEX 3 times. 3 times, y'all. That's my story. That's my why. All right. Couple of testimonies, what you'll learn. NCLEX mindset, the NCLEX structure, farm, management of care, physiological adaptation. I put those 3 in there. You said you wait. No, don't wait. You need to go. You need to take it as soon as possible. All right. We talk about the curriculum, right? This is the curriculum. Like you guys are going to get a review. This is where the days come into play, right? And also already inside of the course right now is the path to conquer the NGN. There are 8 videos, each one of them being less than 30 minutes long, tackling NCLEX questions. All right. And it talks about, hey, you guys could be a part of a Facebook community. That's me, y'all, when I worked at the Burn Center. Right. A little bit about me, what the course is, a couple of different type of not case studies, but freaking, reviews from people. Right. Talks about, all the FAQs. And this is what the course looks like, y'all. This is what it looks like on the inside, right? So we got course videos in here. And then here's your curriculum right over here to the side, right? So look, we got what is the NCLEX, taking the NCLEX, critical thinking, the rules on the NCLEX. And look, y'all, the new generation NCLEX review right here, y'all. Look, check it out. I'm going to show y'all. So we go over questions, right? I go over questions. We talk about them. The questions right here, the topics, right? And then we also tell you why these questions are right and wrong, right? And with the new generation NCLEX right now, with this one, with this review, look, 8 videos, right? 8 videos. Let me show y'all. 8 videos. 99 questions, y'all. There's actually, let me see if I can get there. There's actually 100 questions, y'all. I go over 100 questions with y'all. Right. And then we talk about different tips, how to evaluate your progress, stuff like that. We do memory tricks, stuff like that. EKGs, cardiomyopathy, anticoagulants, all that other good stuff. And then, of course, at the end, you got a good thank you from me. Remember, I want everybody to conquer the NCLEX. But check this out. You also get, a content vault. So you get nothing but a bunch of content. Look, y'all, there are 19. I have 19. You hear me? 19 videos right here for pharmacology, right? That video is 22 minutes long. Every one of my videos is less than 30 minutes except for one. And I can't remember which one it was. I think it's like collaboration with the interdisciplinary team, so on and so forth, right? So we talk about cardiology. I have like 9 videos for cardiology to include shock, the difference between AFib and AFlutter, What else? VTAC versus VFib, torsats, all those, right? So, and you get these, you understand. And look, what's another big one for pharmacology that people have an issue with? Dosage calculation, right? We talk about that. That's 15 minutes, y'all. 15 minutes. We go through it, talk about, the rules, we go through some of the questions, go through some of the answers, right? The examples, IV drip, all that good jazz. All right. So anybody interested in that, that you guys can check that link out in my bio up here, right? And it'll take you there. It's $48, y'all. $48. Let me see what y'all are talking about. Hey, if you guys are new here, welcome. Welcome. I was just showing you guys what my NCLEX course looks like in case, anybody's interested or somebody who wants it. Hey, at least forward it to them, right? Forward it to them. It's like if you fail 3 times, did they give you an extra time? So in Texas, you have as many times as you can take it within 4 years, right? Some places will let you take it unlimitedly. Other places like Florida, you can only take it like 3 times before you have to take some type of like remediation class. Genevieve, thank you for the follow. Appreciate you. Trey says, oh, this is one of the few areas I've not worked, burn center and no dialysis, high stress. Hey, when I first started working as a nurse, I loved the burn center. If I could have stayed there, trust and believe me, I would have stayed there. Oh, you meant fail? Okay, I'm tracking. It says dosage calculation exam the week after Thanksgiving. I have to get a 95%. Ashley, start practicing, right? And like I said, my 7-day NCLEX course, it's not the 7 days. Let me really elaborate. The 7 days allows for us to go through the 8 important things that you need to know within a 7-day period. Because a lot of these NCLEX reviews that you go to, they're 3 days long. They cram it all into you. But all I'm asking is that you take anywhere from maybe 2 to 3 hours out of your day to go over those sections like management of care, which is the largest section on NCLEX at 17, 18 to 23%. That's what that means. And then the next day we go over pharmacology. Take a couple of 2 to 3 days out of your time or 2 to 3 hours out of your day to sit there and go over the pharmacology aspect as well as understanding pharmacology types of questions. Okay. When do you start? You can start it now. It's on demand. It's an on-demand review. Okay. On-demand review. Once you have it forever. You have it for a lifetime. There is no subscription. At least of yet, there is no subscription. Florida, that case is a mess too. Oh yeah. You talking about like the fake nurses? Right. That's a huge big thing. Where can I find it? You can check it out. The link in my bio. The link in my bio will take you to my link tree and it has all of them. And it's the very first one. It says 7-day NCLEX course. Okay. And everything that I just showed you, you will see the exact same thing when you go to that page. Okay. Dosage calculation tip that has worked for me. Break up everything down to 1 milligram or 1 ml. Then work up the rest. That could work for people. Me, is it McKenna? McKenna, you're welcome. But yeah, for me, it's just honestly, for me to do dosage calculations, it was practice. And then more practice is because, me and math just don't math like that. Even though math and conversions aren't all that difficult, but it's just like, me and the numbers don't really get along like that. You know what I mean? So, but welcome to all 70, 80 y'all. Welcome. My name is Kevin. Also, if you guys are looking to get a shirt and you want to be a boot nurse and it tells you that you're the subject of hazing, target of hazing, right? You guys can also check that out. I have merch where you can get a boot nurse shirt. Talk about when I was established, which was in 2020. You can get one of these shirts. I'm also about to put some more shirts up there as well. So I know you use Linktree, but I think you'd like StanStore. They let you do courses, PDFs, and etc. Yes, I have looked into StanStore. I have. So, but I like Linktree right now. I'm a one-man army type deal. I'm doing one thing at a time. But StanStores are pretty good. They are pretty good. I've seen a couple of my mentors that actually use that for different other things. So it's definitely a good thing because now you can just click StanStore and they'll take you directly there and you can purchase from there. It makes it that much easier. So, but I like the Linktree because I want people to go over to my YouTube and check out the videos. Also, these lives will be up on YouTube. Okay. It says also do dosage count RTFQ. There you go. RTFQ. Pay attention to divided doses as well as micrograms. Yep. That's where the big issue and disconnect happens from micrograms and milligrams. They're just like, oh shit, I forgot. It's not the 100th, it's the 1000th. You know what I mean? So remember with the micrograms, smaller doses. Smaller doses. And don't get mLs mixed up with units. Like, don't be out here trying to give 1 unit or 2 units of insulin and then accidentally end up giving 2 mLs. That would be the worst day for you and even worse for the patient. Okay. So don't be that person. All right. Hey, I appreciate everybody rocking with me. What other questions do you guys have? Kate, you came in here kind of late, but you've been asking all the questions and giving and dropping all the knowledge. So I appreciate you. So what else? What other questions do you guys got? It's Friday. Hopefully everybody is ready for the weekend. Bro, these nails are looking disgusting. So your boy got to go get rid of them. But yeah, like I said, I do these 3 times a week. I'm thinking about doing them every day. It says, hey, I made a Medic Farm PDF I sell. I can send it to you for free to see if it would be beneficial for our ends. Absolutely. Go ahead and send it over. You can send it over. I'll take a look at it. And also, speaking of that, I am in the process of making a, I call it conquering the NCLEX. It's like an NCLEX guide, right? I'm in the process of making that. It's going to be pretty dense, y'all. It's going to be pretty dense, going over like multiple different subjects, anywhere from pharmacology to, who do you see first, management of care, all that good jazz. All right. It says, okay. So yeah. So most definitely check. I will check that out. But hey, that ebook is coming out. It's definitely coming out probably here within the next 2 weeks. All right. Black Friday is going to be good. Black Friday, Cyber Monday time is going to be good for everybody to check out, all the stuff that I have to offer. And then, of course, I'm always open to different suggestions for anything or feedback that people would like. Okay. So what else do you guys got? Got about another 5 minutes hanging out here on this Friday with y'all. If you guys are new, we did NCLEX questions. So nursing style questions. We do those at the beginning of the stream. And then I do an Ask Me Anything after that. I got a bunch of questions. We had, we go back and forth on the conversation. So whatever questions you guys have, y'all got me to 67,000 likes, 67,000 likes and 1,100 people at peak today. And it's all because y'all were smashing that like button and y'all were sharing. The more y'all do that, the more that gets out to people that need this. And I do this for free, y'all. I do this for free, with the hopes of y'all wanting to check out my other stuff. I do this for y'all because I didn't have this in school. I didn't have this in school at all. I wish I would have had something like this in school, or I wish I would have known about it. It says, how often do you run sales on your content? So right now, it's the lowest that it's ever been right now at $48, right? And so it all just depends. Like, I want to try to do them around holidays and stuff like that. But right now at $48, most definitely, this is the lowest that it's going to be, right? For a long while. And then also around Black Friday, my coaching is actually going to decrease in price too. So if you guys are interested in the coaching, you guys can go check that out. That link is also in my bio. You get in-depth conversations with me. We do sessions. We break down NCLEX style questions together. You get my phone number. Like, you get a tracker so we can track your progress. You get a study calendar so you know where to start, where to begin, and then how to, essentially like the intricacies in between that of where you need to focus on. You know what I'm saying? You even get a result. I call it a results day. So when you go to check your results for NCLEX, your boy is here with you. Whether you pass or you fail, I'm here with you. So if anybody's interested in coaching for, nursing, NCLEX, mentoring, or anything like that, that link is also in my bio. That says NCLEX coaching and mentoring, or NCLEX one-on-one coaching. It says how often. Okay, so there's that. Also, I'm preparing for the HESA A2. I'm going to retake. What do you recommend for studying? I would recommend either the Mometrics book for HESA A2 or the Trivium 2023-24 book. I use the Trivium and I think it's good. It says, Ashley says, off to film my head to toe assessment. Thanks for spending your time helping us. Ashley, of course. It says, facts. That's why I make the things I do. It's things I wish I knew more in school. Exactly. Thank you for what you're doing. Nice to stumble on your live, sharing with my cohort. Absolutely. I appreciate you sharing with your cohort. Share with your cohort. Let them know that I do these lives. Also, let them know, like, you guys are still in school. $48 for an NCLEX review. $48. Kaylin says, I'm graduating nursing school in 29 days and currently panicking. Kaylin, why are you panicking? That's a good thing. Why are you panicking? So I took my NCLEX 3 times. What do you suggest? I don't know. I don't know. You failed it 3 times. There are many things that I could suggest to you, but I don't know who you are and what issues you have. But I will give you a blanket statement, user 49, is What is your mindset when you go out there, right? What was your mindset when you study for it? Did you study for it? What accountability did you have? Did you have environmental distractions? Did you study effectively? Do you understand NCLEX style questions? Did you study content? Did you do questions and answers? Did you do rationales? Did you reach out for help at any point in time for anybody? Did you have anybody, QC any of your stuff? Like, there's a lot of things that are lined up that obviously I can't answer here in this live. Hell, I can't even do it in a 15-minute free, 15-minute call that I do with people. So like, those are the things that you have to ask yourself. If any of those things kind of stumble away from you, as in like, oh, okay, I only studied an hour a day sitting in front of my TV, blah, 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 while I was on fucking TikTok, then that obviously, that's not going to work for you. So you need to have accountability. You need to understand your environment. Did you recreate the testing center? Like, you failed 3 times. So you know what the testing center looks like. You know what I mean? So were you able to audit or trim the fat of your issues in order to do better? You know what I mean? So if you can answer those questions and then come back to me. 29 days, panicking for the NCLEX. I'm so terrified. I'm not prepared for it. I've been practicing ATI like crazy. So Caitlin, let me tell you something right now. For you to be nervous to take the NCLEX, that is very normal. That's very normal, understanding, all that good jazz. But the one thing that I would recommend is you have to take control of what you know. And you've been studying. Now, there is an issue where you can overstudy. Souk Deep, I see Souk Deep just jumped in here, but you can overstudy. So here's the thing. Like, are you doing the same thing? Are you putting yourself on a schedule? You passed Souk Deep. You passed. What are you, an RN, LPN? You had to let me know. I know Souk Deep, you came in here and you were telling us all kinds of stuff. But Caitlin, that's what you need to do. You need to figure out. You need to kind of just figure out, like, the perfect time for you to study, how much you're studying. You're going to be nervous, right? But the best way to determine where your thought process is and where you are currently when it comes to taking that exam are your Q&A. RN after 2 years on the third attempt. Shout out to you. Everybody shows Souk Deep some love. Came here, was telling me all kinds of stuff about passing and wanting to take it, took it for the 3rd time. Now you are an RN. Now nobody gives a shit about how many times you took that exam. Nobody cares because you're an RN. Everybody shows Souk Deep some love right now. Jocelyn said, I passed my NCLEX on Monday. Thank you so much for all. Let me see. It's kind of blurred out. All your lives. They helped me tremendously. Everybody show Hey, that's 3 people today that came in. All right. 3 people today that came in that told us that they passed NCLEX. It's your NCLEX review for LPNs. It's for RNs and LPNs. If you go to the link in my bio, it'll take you to my website. Boom, right there. It'll say it right there that it's an on-demand course for both RNs and LPNs. All right. So Jocelyn, freaking Souk Deep. Hey, we got 2 nurses that just graced us with their presence. Welcome to the greatest shit show on earth of you guys being nurses. So congratulations to y'all. What is one piece of advice that you could give the chat right now? And that's for both of you, Souk Deep and for Jocelyn. What's one piece of advice that you could give? Because we just had somebody come in here and say that they're nervous to take their exam. So what advice would you give them? LPNs taught this RN, and I started with for real old school. Hey, straight up. 3 out of 6 semesters of nursing school. Okay, is it Fernie Rodriguez? Okay, halfway there. All right, let's see what we got, y'all. Congratulations, Jocelyn. Shout out to y'all. Okay. What else are we thinking? Y'all got me to 67,000 likes, so I'm super, super proud of y'all. I appreciate y'all. I appreciate all the love. Don't overstudy. Also, buy Quick Facts by Remar. So you bought Quick Facts from Remar, so that helped you. All right. So there's also other options out there for you guys, right? You got Quick Facts from Remar, right? What else? Join my lives. Hey, be a part of the live. Be a part of the family. All right. And the people that are here that are already getting advice, they already know what the deal is. I'm in my last semester. It's surreal that I'm a month away. Hey, I'm telling you right now, before you know it, you're going to be standing in the floor taking care of patients by yourself. You're going to look back and be like, damn, that went by so fast, right? So shout out to my 3 people that became nurses. All right. How many hours did you study in a day and how long? It all just depends. For me, I could study a little bit longer because I got to study during the pandemic. Now, I don't know what your work schedule is like, McKenna. I don't know what it's like. I don't know what your day-to-day is like. I don't know what your environment consists of. If you're married, kids, you have, responsibilities. It all just depends. You can study for 2 or 3 hours a day. You can study for, an hour a day, but you need to be able to do it. I don't know. So that's where I say you have to audit your time. Right. Hey, and here's the thing. I don't care what nobody says. I hear people say, I don't have time to study. Ooh, that's a lie. Everybody got the same time. Everybody got the same time. You better learn how to reallocate your time. Okay. Soup Deep. Listen to TikTok anywhere knowledge comes from. Join the live I used when down. Yep. Because Soup Deep was down a lot and came in here and started talking a lot. Oh, man. My man James is in here. James, sir, you missed it. Hey, we got 67,000 likes. And I had 1,100 people in here, 1.1K people up in here, James, 1.1. So shout out to James. Hey, anybody interested in doing business type of stuff, you want to create digital products and stuff, you guys check out my man, James Ward Biz. He just jumped in. Good guy. Talked to him a bunch of times on his lives. He definitely can point you in the right direction if you're thinking about nursepreneurship. Okay. So there's that. Advice as a new grad. Jocelyn, my advice for you is to be a sponge. Be very attentive, take in all the information, ask as many questions as you can. Don't let them dismiss your questions. Don't let them bully you. Okay? Don't let them do it. Ask as many questions as you can. Hey, so I have a notebook I usually kept when I would ask questions and if people would refuse them or anything like that. You know what I mean? And also hold people accountable. But we got to remember people are going to hold you accountable, right? And don't do things if you feel uncomfortable doing them. Always ask for help if you need it. Okay. That would be my advice, Jocelyn. I hope that was good enough advice for you. Separate your day. Small 3 to 4 peep study group. Just hit it like lightning. As many NCLEX as you can. Yeah, you could do that. I personally don't like doing study groups for NCLEX specifically. And if I did, it would have to be maybe once a week or once every couple of days, is because when you take the exam, you take it alone. You take it alone. So, but my man James jumped in here. Cool. I hope you're doing your live later because I'm going to be there for it. But shout out to everybody that joined my live. Your boy is about to go get his eat on, but I appreciate and love every single person that came through. We got to 67,000 likes. We had 1.1K people in here at peak for literally, I think 10 minutes, right? And I thought that was great. So it's a constant thing to keep people in here and just dropping this knowledge on you guys in some way, shape, or form. Okay. So last couple things, of course, if you need an NCLEX review, 7-day NCLEX course is live. It is $48. That link is in my bio, right? And it's $48. You get it for a lifetime. It's for LPNs and it is for RNs and LPNs. There is also a new generation NCLEX review that's in there where I go through 100 questions and I talk about memory tricks at the end. It's so much. It's so dense. Hey, Kevin, I failed my first anatomy in the BSN. Should I rethink my career? No, you should go back and restudy. Check out Khan Academy. Is it Ty Jiggles? I would check out Khan Academy on YouTube when it comes to anatomy. That's a good YouTube channel. Okay. So yeah, 7-day NCLEX course, $48. It's an on-demand course that you can use as much as you want. Okay. And once you have it, it is yours forever. If you need coaching, one-on-one mentoring, it says, how does a 7-day help with NGN? I just said it. There's an NGN review that's in there where we go over questions and answers. And NGN consists of case studies, and different type of questions. So McKenna, I think I don't know if you said you purchased it, but if you go in there, you'll look and I have it right there. It'll say, if you go down where it says 7-day NCLEX review, it'll say the path to conquer the NGN. And then there's 8 videos, each one of them almost 30 minutes long, where I do 100 questions. 100 questions where we read the question, we talk about the topics, we talk about the rationales of why they're correct and incorrect, and then we go on to the next one. Okay, so that's what it's for. Go check it out now because it's going to go up in price. Okay, if you need coaching or mentoring in regards to NCLEX or even mentorship as a nurse, check out the link in my bio, which is the NCLEX coaching and mentoring 101. You guys can check that out as well. And then lastly, take care of yourself, y'all. Should I go back to school for RN/BSN at 45 as an LPN? I don't know. Angel, that depends on you. Do you want to go back to school? People come in here and ask me what they should do. You already know what you want to do. You don't need my validation and you don't need my permission. You know what? As a matter of fact, I give every single person in here permission to go back to do what they want to do for themselves in a positive way. If you want to go back to school, Angel, I'm going to say this in the nicest way possible. Take your ass to school. Okay? Go to school. Go to school. Do it for yourself. Do it for the self-gratification because that's what you want to do. I give everybody in here permission to go and do what you need to do. All right. And don't come back here until you do it. No, Angel, please come back here 3 times a week. OK. However, go do what you need to do. All right. Yes, you will. You will do it. I haven't. I wouldn't take long. I can't imagine that would take. Doesn't matter. Just go and do it. Just go and do you. OK. But lastly, take care of yourself. Right? It's the weekend. I know kids are getting out of school. Thanksgiving's coming up. You know what I'm saying? Be kind to yourself. You only got one you. Okay. If you can't take care of yourself or if you can't have self-gratification, if you can't do all these things that are positive for yourself, you're not going to be any fucking good to nobody. You know what I'm saying? So I appreciate everybody coming to the live. I appreciate everybody who is investing in me and the product, aka also investing in you so we can make this thing bigger than me because it's not about me. It's about y'all. All right. So with that being said, take care of yourself. I'll see you guys. I appreciate the heart. I appreciate the heart. Thank you, Angel. And like I said, we do these Monday, Wednesday, and Friday. And I will see everybody Monday at 5:30 Central Standard Time because, baby, that's the only time that matters. And everybody have a great weekend.